Good morning. I'd like to call the Finance, Ways and Means Committee to order for March 4th, 2024. Mr. Clerk, would you please call the roll?
Representatives Barrett, Boyd, Camper, Cochran, Crawford, Faison, Freeman, Gant, Garrett, Hawk, Hazelwood,
Here.
Hicks of Hawkins, Hicks of Washington, Kiesling, Lamberth, Love, Lynn, McKenzie, Miller, Moon, Parkinson, Shaw, Sparks, Whitson, Williams, Zachary, Vice Chair Baum. Madam Chair, you have a quorum.
Thank you, Mr. Clerk. Do we have any personal orders or announcements this morning? Seeing none, just welcome again on at least it's a pretty Monday, to Finance, Ways and Means. We have 5 budget hearings scheduled today, and without objection, we will go out of session and go straight to those hearings. First up, we have the Department of F&A. Commissioner Bryson, if you would come forward with your team. Good morning, Commissioner.
Good morning. Hope you had a good weekend, everybody.
I won't speak. I hope people had a better weekend than I did. We'll just leave it at that. But thank you for your thoughts.
Good.
Commissioner, if you want to just get straight into it, we will try to march through these efficiently and get you and your team back on to, I know you're working on an AA and a few other small projects. So please just begin your presentation.
Thank you, Madam Chair, later members of the committee. We will make this brief and move quickly as we can. With me today, I have Deputy Commissioner Eugene Newbert, also CIO Stephanie Dedman, and Director of OCJP, Jennifer Brinkman. As you know, F&A is a very broad department with many operating divisions. Today, we'll present our budget request for just 3 of those divisions. Afterward, we will be available to answer any questions that you may have. And with that, I'll turn it over to Deputy Commissioner Eugene Newbert.
Well, if I can find the right button. Thank you, Commissioner. Members, I'm going to talk about the request for benefits administration.
And just for the record, if you would state your name and title.
Yes, ma'am. Sorry. Eugene Newbert, Deputy Commissioner. I'm going to talk about the budget request for benefits administration and then turn it over to Stephanie to talk about the request for STS. As many of you may know, Benefits Administration is the largest purchaser of commercial health care in Tennessee, providing over $1.75 billion in medical, pharmacy, and behavioral health benefits annually, serving over 330,000 people in Tennessee across 600 agencies in our state, local education, and local government health plans. BA's mission requires technical skills in some pretty high demand areas in our market. Think about healthcare, customer service, and data management expertise. To remain competitive, we need to make sure that we're paying classifications and positions at the market rate. Some of those classifications in benefits administration are below counterparts in other state agencies and the private sector here in the Nashville area. So I request just to add $780,000 in salary and benefit costs. This will help to bring several classifications across the division up to market. Benefits administration is funded by premiums charged across the various plans. This equates to less than 23 cents per member per month in premiums, and the monthly premiums that are set in calendar year 24 are sufficient to cover. I'm sorry, I didn't advance the slide. Are sufficient to cover the cost of this request. I'm going to turn it over to Stephanie. Before I do, I want to hit on just a couple other things. We do have a supplemental request for the Office of Criminal Justice programs in fiscal year 24. That $50,000 is related to the administrative cost of administering the higher ed safety grant program. You may remember the $30 million that you allocated to F&A for higher ed safety grants in the special session. This is just the cost of administering that program in the current fiscal year. We also have reductions, little less than $500,000. 46,000 of that is state appropriations. That represents space reductions in the Tennessee Tower, where F&A has gone from 4 floors to 3 floors in the Tennessee Tower. Stephanie?
Thank you. Stephanie Dedman, Chief Information Officer with STS, part of the Department of Finance and Administration. We'd like to walk you through 3 key areas. Most of our requested budget increases are related to either customer-focused IT, cybersecurity, or strategy, modernization, and maintenance. Just to, and I'll touch on some of the higher level increases, but certainly welcome any questions that you may have. This slide talks about or shows really the scope and breadth of the services that STS provides in terms of supporting our agency customers. And I'll talk about cloud modernization, I mentioned agency support, and then enterprise resource planning. For cloud, we have a $7 million increase. We have been migrating applications to the cloud primarily using ARPA dollars, and this cost increase represents operationalizing, running the cloud, and billing our agencies for their compute and support with applications in the cloud. There's a $22 million increase in agency purchasing. That represents a pass-through. STS does all of the procurement for laptops, desktops, and other software and equipment for our agencies. So that $22 million is in the agency's budgets already, and this is just a pass-through for us to be able to have that budget room to charge them. And then lastly, a 2.2 increase for ERP focused on a grants management application and implementation support for that application. The next slide talks about cybersecurity and the breadth of the services we provide across state government really fall into incident detection and response, vulnerability and threat management, and application assessments. We have a total request of $300,000 recurring for cyber, and that represents some additional tools and mobile blacklisting capability. And last category for our increases represent strategy, modernization, and maintenance. This slide shows, again, the breadth of support. We have over almost 42,000 Office 365 users. We, through our vendor partner, manage 21,000 miles of fiber. Our contract increases are reflected in this particular request. And then we do still have a number of applications on the mainframe that we are working fast and furiously to depart the mainframe and not rely on that older technology. The request you'll see for Office 365, again, we used ARPA dollars to purchase that tool, and we now need $3 million for annual maintenance to keep that running. Our network contract, we did a competitive procurement to re-procure our network services, and the existing vendor did prevail, but there is a contract increase in the cost for that service. $500,000 for Oracle licensing for some of our software developers. And then our mainframe, as I mentioned, we are down to about 4 or 5 applications still running on the mainframe. Several of those are actually going to be decommissioned this month. But our offender management system for the Department of Correction will reside on the mainframe for about another 3 years. And so we had to renegotiate a renewal of the contract for mainframe support, and that resulted in a $6.5 million increase. That touches on all of my updates. I'm happy to take any questions you might have regarding our increases.
Thank you. In closing, I'd like to mention a couple of things that were not on our presentation. First, there are 2 reserves that have a significant balance carry forward, as noted, as has been noted. The first is the Violent Crime Intervention Grants, which has a balance of about $98 million. And the second is the Evidence-Based Programming Seed Grants for our local jails with a balance of about $25 million. Both of these grant programs Can you hear me now? Okay. Did you hear what the grants were? Okay, well, they were the violent crime intervention grants for $98 million and evidence-based programming seed grants for local jails of $25 million. These are large balances that you will see in the budget. Both of these grant programs are cost reimbursement grants that have been awarded, but we are waiting on local recipients to send their expenses so that they can be reimbursed. Also have very good news in the cost reduction category. As you all are very much aware, I want to thank you for the last couple of years putting significant amounts of non-recurring funds into our OPEB liability and getting that down to virtually zero. We had money in our base budget to pay that off over 20 years, and since it is now paid off, we will see a savings of $20 million this year in our base budget that we are excited about. So thank you for being very conservative in budgeting and getting those liabilities paid off quickly. And we're seeing the results and the savings from that. Thank you for your time, and we're glad to answer whatever questions that you may have.
Well, thank you, Commissioner. There's a lot of information here, and members, as always, this is on your dashboard, so you can flip back and forth as we're going through the questioning process. And because I know there's a lot of information on some of those slides, and it was up very briefly, but you can find it on dashboard. I do have a list of questions, beginning with Chairman Hicks.
Thank you, Chair Lady. Commissioner, it's certainly good to see you and your team here this morning. And my question is going to be directed toward our CIO, Ms. Dedman. You mentioned the $22 million recurring for the hardware and software purchases, which again is recurring. The current spend authority is $53 million. Of course, this is going to be increased by the $22 million, again recurring. Could you talk a little bit more about that? Why is that needed? Why is the increase needed? What is the life cycle of the equipment, and will the software require subsequent upgrades and maintenance?
Yes, sir. Thank you for the question. Hopefully I captured all the pieces of your question there. If I didn't, please correct me. So that $22 million does represent agency requests for additional equipment. Some of that is, a good bit of that is we do recover from the feds. A portion of that. It is life cycle on our equipment is 3 to 4 years. We replace laptops and desktops every 3 to 4 years on a cycle, and so that does represent some increase. In a couple of examples, some of the agencies have asked for, or the federal government has asked for additional programs, which requires more equipment and software. That cost would include ongoing maintenance as needed for the software. So I think I hit on all your questions. Does that help explain?
Yeah. And so just continuing on with that. So will this ultimately result in increased billing to the agencies on top of billing increases that are included in this proposed budget?
Yes, but they do have or will have in their budget the $22 million, and so it is a pass through where we're billing the agencies to pay for the equipment that we purchase. And there's benefit of centralized purchasing in terms of volume and better negotiating prices with our vendors, since one particular entity does all of the procurement and maintenance.
Okay, and then my final question, Chair Lady, looking at the recurring funding for STS rate reviews, can you talk a little bit about why the billing increases have been needed in recent budgets, and how does the STS billing scheme work? And then, well, we'll just stop there.
The rate increases that our services represent are almost always based on increased contract prices or increased costs from our vendors. And so we negotiate and try to manage those best we can, but the cost of technology across the board is increasing. You said rate increases. What was the second part of your question? I'm sorry.
Why have billing increases been needed in recent budgets?
Okay. And so that is related to increasing inflation and cost increases from our contracts and vendors.
Okay. All right. Thank you very much. Thank you.
Thank you.
Thank you, Chair Lady.
Next, Chairman Bond.
Thank you, Madam Chair, and good morning, Commissioner Bryson. Your department recently received about $200 million in funding for strategic technology solutions, and about a fourth of it's been spent, let's say 50 million. Can you tell us how this money has been spent so far?
I'm going to turn that over to CIO. Is that ARPA dollars we're talking
I believe
about?
so. I apologize.
is,
Could
it
you,
is.
ARPA spending? Yes, so we requested a number of, or have a number of projects in flight. Some have been completed. They are primarily around cybersecurity, modernization, agency business applications modernization, also around maintenance and I think I mentioned cybersecurity. Trying to think of our categories. There business process automation. So in summary, it was about accelerating some of our key initiatives and continuing to keep us protected from a cybersecurity standpoint. And then most importantly, probably our agency modernization. There's a number of dollars that are being used for replacing and modernizing business applications.
And there will be a deadline to spend the rest of this money. Do you
That's-
have a way of ensuring that we will be able to get it spent?
I do. We manage that very closely and also in partnership with the Department of Finance and Administration's Office of Business Finance. We have very stringent tracking on projections and the deadlines, and are reviewing on a monthly basis how we're spending against that plan. Do we have sister initiatives that dollars can be used for? That's all within a very stringent change management review process, both internally and with our consultant Horn, to make sure we are spending federal dollars wisely, and obviously could pass an audit. But so we manage that, like I said, on a monthly basis, and are constantly evaluating, will we encumber and spend the dollars by the two deadlines?
Chairman Bond.
Okay, and the next question, with that money, and then also with some money that's been allocated by the state the last several fiscal years for data sharing across departments, can you tell us a little bit about whether that's resulted in data sharing across departments improving?
Yes, sir. It has resulted in improvements. We still have some progress there, but we have migrated our P20 data to our TN Data Hub, and continue to migrate additional agency data sets for sharing. So summarized answer would be, we've made progress, and we still have some ways to go to improve our data sharing.
Okay, and maybe last question. Are you able to use the data sharing to measure different outcomes of different programs around the state to track things like that?
Yes, appreciate that question, because that is one of the initiatives we're working very hard on. And of course, what we've been working on are program inventories in every department, so we know what the programs are, know what the evidence needs to be to prove whether they are successful or not. This year, we began to get, for this budget cycle, we began to get the first tranche of data back that's showing how these programs are progressing. And so we are looking at that data very carefully and to see whether programs are doing what they're supposed to be doing. And so we're also going back to those departments. The process is starting to go back to those departments and talk about how they not only have data, but how they use the data to do that kind of analysis on their own, as opposed to FNA coming in and doing that analysis for them.
Okay, thank you all.
And just a follow up, in some part of the presentation early on, I think there was some conversation about ongoing maintenance cost for the, ARPA dollars are wonderful. We've been able to do a lot of things with them, but all this new technology that we've invested in is going to require ongoing maintenance. So can you tell us what the impact on the budget is going to be, this year and, in subsequent, like the 3 to 4 year cycle, and how we're planning to cover for those additional costs?
I think we'll need to get back with you on that, Madam Chair Lady, and get you that kind of information.
If you could do that, that would be great. Thank you. Chairman Zachary.
Thank you, Madam Chair. Good morning, Commissioner and team. Quick question related to cybersecurity. In FY 22-23, we appropriated 23. Everybody caught that. Go ahead. That's good. Thank you. Get that out of the way. All right. We appropriated $2 million in recurring funds for cybersecurity training and assessment for local governments, and we appropriated 1.9 non-recurring funding for a grant program to support local governments. Can you give us an update on both, to the update on the 2 million, and then how much is remaining of the 1.9 that's non-recurring?
Thank you for the question, Representative. I can definitely give you an update on the two projects. I might have to get back to you on where we stand on the spend and what's remaining. The first one was also part of our ARPA projects, but we had some recurring requests as part of Chair Lady Hazelwood's ask, is working with the local governments to conduct what's called a National Cybersecurity Review. It's a standard review. We did that for all state agencies first, and then have been working with the local governments. I don't have the numbers in front of me, but we are on track to meet the date. And as the feedback that we get from the completion of those assessments, we're developing plan of actions that need to be taken to shore up any particular major themes or major areas of cybersecurity weakness. So that's going well. The local governments have been very supportive, and if you would like additional information as we progress and develop kind of the formal programs going forward, we'd be happy to provide that. On the grant program, that is the state's required match for a federal cybersecurity grant program. We have received the first year of funding and actually have been reviewing the applications from the local governments. There's 3 different categories. One is to provide cybersecurity training, again, to the locals. The second is it is escaping me, but the third one is an open-ended. They can request funds for what they believe they need, and we are in the process of reviewing those applications and making the awards actually in the next 2 or 3 weeks. So we've made good progress with both of those as well.
Very good. Thank you.
Yeah.
Thank you, Madam Chair.
Chairman Williams.
Thank you. Thank you, Commissioner and team, for being here. I just wanted to follow up on the violent intervention grants. 2 years ago, we did $100 million. Then we did $50 million last year. That was more, I guess you could say, strategic in the locations where we're sending those based upon violent crimes that were occurring across the state. Could you give me just an update on where we are on the distribution of that first $100 million, that first tranche, if you will?
Yeah, Jennifer Brinkman, Director of OCJP, will be best able to answer that.
Thank you for that question. So for the first 100 million, we have 306 grants and it's 100% obligated. So at this point, the contracts are out. We're waiting on the expenditures to come back in.
So in the instance, if I look at the report of those people, those dollars that you have reimbursed so far, even though some of our communities may show a zero balance, meaning they haven't been paid those dollars, it's not because the money hasn't been committed. It's because whatever the grant was requested for has not yet been completed. So therefore they can't ask for the money back. Is that correct?
That's right.
Okay. As it relates to the $50 million that is out there, can you give me an update on the second tranche of funding for that $50 million that was for those, I guess you could say, those violent crime areas by zip code?
Absolutely. So 10 of those zip codes, they were in Shelby County and in Davidson County.
Okay.
That left 4 law enforcement agencies that were eligible for the funding. We have met with those 4 agencies. Each has a grant. Memphis Police Department and Nashville Police Department are the largest recipients of that 50 million. So they are in a planning stage. They have a coordinator. They have community meetings that they're holding, but they have not taken all of the funding in a contract yet, if that makes sense. So they have a letter for funding. We've obligated the funding, but we don't have the contracts up to the full amount yet.
So your department is communicating with those people to make sure they are aware that the monies are there, so that they can expend those. I guess that kind of begs the question: do you think are those, much like the $100 million, are those monies pretty much committed, or we're yet to commit those because we don't necessarily have a plan yet?
They're committed. We have committed that that funding will go to those communities. I think the nuance there is if the cities came back and said, no, we don't need that full amount of funding for those projects that we were thinking we needed.
Okay. And in the instance of that, Commissioner, does that mean any of those, is there a deadline for when those reimbursements have to be submitted? And what happens to that money if it's not utilized?
So the contracts for those currently are through 2027.
Thank you.
And just to follow up, I understand 2027 is a long ramp that they have to spend this money. But do we have signposts along the way where we know if they're on track? Because I'd hate for us to get to the end of 2027 and, just be a whoopsie. So,
Absolutely. What we're doing with them is the projects will have 4 different components. It'll have prevention, it will have offender intervention, victim resources, and then law enforcement activities. And they are submitting a logic model with outputs and outcomes for each of those 4 areas, so to speak, so that we can track their progress.
and again, I guess that brings up another question. These are projects that people think will help solve the problem or reduce the problem or whatever. But through this outcome tracking, if we realize that something is not working, is there the ability to pivot and move on to a different tactic?
Absolutely. We would pivot and do amendments at that point.
All right, thank you. Representative Lynn.
Thank you, Madam Chairman. Thank you for being here. Thank you, Commissioner. Ms. Dedman, it's nice to see you again. We saw each other last week at the Information Systems Council meeting. The department received $20 million for crisis pregnancy center grants in the FY 23-24 budget. During your budget hearing last year, you stated that the plan was to convene an interdisciplinary multi-agency advisory committee for administering these grants. Would you please provide us an update on how these grants will be administered or have been? Has the grant application started? And when will funding go out the door for these grants? Thank you.
Thank you for that question. That's actually very exciting because we received 95 applications. So the interdisciplinary committee did meet, put together the plan. We released that plan before the holidays. Grants applications were due in January. The review team has reviewed all 95 applications. It was over $65 million that was requested in funding in those 95. We had 20 million that was available. So 28 of those agencies are going to be funded. Those contracts we're hoping to get out by mid-April at the latest.
Representative Lynn.
The grants that were not funded, was it because their plan was incomplete? Was it first come, first serve? Is there the ability to reduce the ask? Say if they ask for more than the program allots, is there the ability to reduce so that every applicant that qualifies gets a grant?
So we did do some reductions so that we could fund more. Originally, if we did the full million for each, they would not have gotten, we would not have had 28 applicants that could have been funded. There were quite a few applications that came in that were incomplete, so they would not have been fundable. And then we had some priority areas, and so the ones that met the priority areas were the priority for funding.
Representative Lynn.
The incomplete applications, is there any grant assistance? Can they call for advice and say, I don't understand this? How can I do this correctly?
Absolutely. We work with the University of Tennessee SWARP's office, and they are helping with grant writing. And if there's more funding that we've become aware of, that office would absolutely help them with that.
And of the grants, the 95 applications that were received, 28 were funded, some were incomplete, whatever. I guess my question would be, how much money would we have needed to fund all of the grants that were, if we'd had enough money, they were fundable. It's just that we ran out of dollars before we got to them. Do you have any idea what that amount would have been?
We're guesstimating because some of them, their budgets were part of what was incomplete, but it was about 65 million that was requested that we could document.
Okay, thank you. Chairman
No, it was,
Crawford.
I'm sorry, it was 45 million that we couldn't fund, 65 that was requested.
Okay. So 45 million went unfunded. And did that include the incomplete grants?
Not all of
Requests.
them. Some
Okay.
of them we couldn't figure out.
All right, thank you. Chairman Crawford.
Thank you, Madam Chair Lady. In the 23-24 budget, it included $13 million of non-reoccurring funding to offset the decrease in the VOCA awards. What are the future projections for the VOCA awards, and how are these decreases going to affect the funding of the agencies and the victims at this time?
That one is not as happy of a story as the last conversation that we had. The federal dollars are estimated to continue to reduce. We are at 28 million for the current award that we expect to get in 24, but they're estimating that it'll be about a 41% reduction for the next award. So we're guessing 16 million. So the reductions are going to continue. The one thing that I do say, and this does not lessen the blow for those reductions, is that in 2016, we were averaging $9 million a year in VOCA funding. So we're still above what that original amount was for federal funding, but that doesn't negate the blow or negate the need, obviously.
Thank you, Madam Chair Leader.
Chairman Kiesling.
Thank you, Madam Chair. Folks, good to have you with us. The subject here is vacancies. Vacancies. February 27 this year, Edison reports that your department had 167. 28 of those have been vacant for over 12 months or more. A part, what hiring challenges are you facing?
Yeah, I'm happy to start, and Stephanie may have some specifics, particularly in the IT area. I think some of the challenges is still, even though we've done significant improvements on salaries, Nashville, where the majority of our positions are, is just a highly competitive market. So when you think about the large majority of our positions are of accountants, they're IT professionals with particular skill sets. They're grant administrators who that's just a high demand area for a lot of employers here in Nashville. Some of the long-term vacant positions, there's a few of those that are actually on the list to abolish with this budget. They were allotted as part of a pilot program in statute a few years ago. Those are going away. They were never filled. Some of the others are actively being pursued. We've again just had challenges to get those filled, but there are some strides being made in that area.
If I may, I'll add to a little bit to that. We have about in F&A, we have two major divisions: STS, which is technology, and accounts, which is obviously accounting. So both together, that's about probably in the neighborhood of 1,900 employees, and that are in accounting and technology, which are two of the most difficult areas to hire and retain people. So we are working hard to hire in those areas, working hard to retain in those areas, and to reduce turnover, so that we keep those positions filled.
Okay. Thank you, Madam Chair. And you just, Commissioner, you just answered the next B part here. What are the what has been, excuse me, the hardest categories to fill? And I think you just addressed that. So with that, thank you again for being here. Madam Chair, thank you.
Thank you, Chairman Kiesling. Representative Barrett.
Thank you, Madam Chair. Representative Miller, do you mind sliding just a little bit to your left? Thank you, sir. Good morning. How are you? I'd like to have just a little bit of conversation about the evidence-based seed grants for local jails. In 21-22, there's, I think, $40 million in non-recurring funding that was provided for that grant. And then we followed up the next year with a little over $300,000 to create 4 positions. So can you tell us a little bit about what's going on with that grant program? Have the positions been filled, that sort of thing?
Thank you for that question. Can you hear me?
Yes.
Okay. So for that program, we have 27 grants at this point. So 27 local jails that have partaken in the funding. It has been slow to start, and not because we didn't get the funding out, so to speak. It's been really hard with the local jails with elections. So we've had some election turnovers. We've had some jail administrator turnovers. But in all of that, we've got 89 programs that have started in local jails, almost 3,000 that have completed, or not completed, that have partaken in a program, 2,000 almost that actually completed a program. Of those 27 jails, 21 bought computers or laptops so that inmates could take those classes in places other than a classroom, which has helped. The biggest hurdle has been finding locations for the classes to take place in the jails. Jails weren't created in a lot of these counties for classes to occur. So we've been working with them on alternatives to construction, like looking at pods rather than construction, so that we can get that done. And then offender movement has also been another barrier that we've had to really work through on safe offender movement to be able to get to the classes when they're understaffed. So that's kind of some of the stuff that's going on there. We do hope we're going to be posting a rolling solicitation. This is not so that when jails are ready, instead of doing it as one big competitive process where we take them all in, we stop and there's no option, we're going to go to a rolling solicitation so that some of those smaller jails, when they're ready to test, instead of going for $1 million or $2 million, they can do a smaller grant to test the waters and see what they might want to do. And we're hoping that that helps some of the rural communities also.
Representative Barrett.
Can you tell us how much of the grant has been appropriated and how much is remaining?
We have about 8 million remaining.
Okay. That's all I have.
I want to go back on the slide when we talked about your budget increase request on the benefit administration salaries. I believe the comments were you needed that to make these competitive. So were they part of the market rate study? So how have we determined that what the competitive rate is?
Sure. No, thank you for that question. They were a part of the market rate study. Some were adjusted, some were not as a part of the study. So of looking at positions in our program director area, our insurance benefits analyst and specialist, of insurance benefits manager, of insurance benefits data analyst manager, the benefits administrator and examiners, insurance benefits data analyst, advanced, are the classifications that we're looking at. Of when we compare our positions to private sector market positions in Nashville, and compare them in some cases to positions in TennCare and other state agencies, the comparative work that our staff are doing, the comparative job responsibilities and requirements as far as education and experience, our positions are still lagging when we compare to those categories. So we've worked with our Office of People and Development, also will work with and have worked with the Department of Human Resources to do that market analysis, have done that market analysis to ensure that positions are moved to the right place in the salary grade scale.
And how many positions are we talking about that will be covered by this $780,000?
I don't have that. I can get you how many are part of that category in those classifications.
If you would, please.
Yes, ma'am.
Thank you. Representative Love.
Thank you, Chair Lady. And this is sort of a follow-up to Representative Williams' questions about the violence interruption grants. When we talk about the $50 million that's going to 2 counties in Tennessee, my question would be this. are the law enforcement agencies required or are they encouraged to collaborate with nonprofit organizations? The reason I ask is because I found oftentimes nonprofit organizations outside of law enforcement are already operating evidence-based programs that reduce violence in their neighborhoods. The challenge oftentimes is they don't have adequate funding. And when opportunities like this come available, it's kind of hard to make that connection with the group receiving the funds. One, because they don't know the funds are there. And two, the agency receiving the funds might not always think about them first versus an internal program. So are they required or encouraged to participate and collaborate with or fund as sub-grants nonprofit organizations outside of law enforcement?
Yes, part of the process, and that's why we're doing it in kind of planning pieces, is for them to have community meetings in those communities that are most impacted by violent crime and homicide, and to bring in the community for those planning meetings. So that's the first piece of it. The second piece is we're highly recommending that they do partner with local community agencies, understanding that not every one of those counties, or not counties, zip codes, I keep saying counties, every one of those zip codes doesn't necessarily have providers that are based in that zip code, but they may have providers that are in the area, know that community, and are trusted in that community that they could work with.
Representative Love.
Follow up, please. So thank you. And from what I'm hearing you saying is that the provider does not necessarily have to be situated or headquartered in the zip code to provide services in the zip code, correct?
That is correct.
Okay. Last one, Madam Chair. if I could.
Representative Love, please continue.
I would just encourage the agency, if we can, to maybe have more conversations with the recipients about the urgency for them to collaborate so that we can get that faster turnaround. I'd hate for us to come into this budget cycle with opportunity to allocate more dollars toward that. And we're looking at 2027 for last year's, only because I know my experience has been this. One of the zip codes in Nashville is in my district. And I've been trying to encourage the nonprofits to have conversations with the chief and trying to get the chief to do the same thing. But we need maybe a louder voice to say, do this so we can get some results turned around faster. So thank you all for that. Thank you, Madam Chair.
Chairman Williams.
Thank you. You mentioned something earlier, and it's I just want to get some clarification on it. The monies that we spent for OPEB last year to allow us to close that shortfall that we've been trying to do forever. You mentioned earlier that there was like $20 million of savings for us. I know what we were trying to do when we spent that money was instead of having to spend a portion of money over a period of time, that we're able to fund that up front and then close that gap. I guess the question is do you expect that $20 million will be saved on a recurring basis, or just during that short period of time that we hope to close that loop to get it fully funded?
I'll get my budget folks to give you a better answer, but my understanding is that the 20 million or even more actually will be recurring over the next few years, and we'll be able to see that. Because what happened was we had a 20-year plan to pay down the OPEB liability, and we had put it into the base budget. And so that plan, when we paid off the debt, we don't need that base budget anymore. So we're seeing that come back to us again as spending as able to be spent. So I expect it to be around next year as well.
Okay, thank you very much.
It'll change the base budget.
Yeah, I did notice that the wise sage, gray-haired sage back there named David Thurman was giving you the nod as you were saying that. So I do know that that is the case. But thank you for your answer.
If Dave says it's so, it's so.
It is so. Thank you.
And just to confirm, when you say it comes back to us, comes back in the general fund, where will we find that $20 million? All right. Thank you. Leader Camper.
Thank you, Madam Chair. Thank you, Commissioner. Good to see you. Sorry I was late getting in to hear most of your presentation. Was impressed to see the stuff in STS that you're doing. I remember when all of that came about, and I presume that our cybersecurity and all of our agencies are pretty secure, so I'm appreciative of the work you've done in that arena. My question is around the grants that we keep talking about with respect to monies going to the high zip codes, and it was like $100 million pot and a $50 million pot. My question is whether these grants, and I thought I heard this, so I need some clarity because maybe one is and one isn't. Are they reimbursable, or are they just like one-time grants to the agency to disperse and do, or do they have to spend the money, ask for it back? Can you talk a little bit about the requirements within the grant contract and how this money will flow, is expected to flow to the agencies?
Absolutely. So these grants are reimbursement based. So that does mean that the agencies have to incur the expense, and then they can request reimbursement from us, and then we turn around the reimbursement for them.
Thank you, Madam Chair. That's for both pots of monies, the 100 million we talked about and the 50 million that are the high zip codes.
That is correct.
Thank you. And thank you, Madam Chair. Commissioner, appreciate you, all the great work, you've done. I really do appreciate your willingness to, hear us out and take our recommendations to heart. The savings you just mentioned about the 20 million, I really appreciate it, and look forward to, all the great work that you're doing at the FNA. Thank you, Madam Chair.
Leader Camper, to your point, I think it's worth noting that because of the fiscal responsibility of this committee and this administration, when we had those dollars to go ahead and prepay or pay down that OPEB liability in a budget year like this one, that's really critical because that allows $20 million that we would not have had to be able to spend on other state projects and needs. So again, the wise use of not spending every dollar on new things, but really looking at ways that we can impact future budgets in a positive way is paid off, because we all knew that we wouldn't forever be in this generous type budget cycling. So again, just kudos to all those involved in working out from the treasurer on down and getting that done. Chairman Hawk.
Thank you, Madam Chair. Commissioner Eugene, thanks again. Something piqued my interest when you were talking about the workforce challenges that we've got. In the last decade, we had heard over and over about some of the alternative workplace solutions, AWS. Is that still a thing? And the reason I'm saying that is we may have other folks who would love to come into employment for the state, but may not live in Davidson County, and could be actually a little less expensive hire if we could look other places in the state. Thank you, Madam Chair.
Yeah, thank you, Chairman Hawk. AWS, which is, if you're not familiar, is the state's terminology for working from home, essentially, or working remotely, is still something that many people in the state do. And I know in FNA, it's a high percentage of our employees because they can. And so that's considered a benefit. As far as just overall recruiting and retention, I want to thank you all for the work that you have done to provide increased pay and benefits for our state employees, because through the last couple of budgets, you all have provided those funds, which for these, especially these difficult to hire positions, have greatly increased our ability to hire and retain good talent, not just bodies, but talent. And so I want to thank you for that. We've made tremendous progress in that area, and that combined with what you mentioned, which is the work from home or work remotely, there's some great benefits for working for the state. And I get appreciation from departments on a regular basis for how we have improved their ability to do the work they are assigned to do because of the pay and benefits improvements that they've seen over the past couple of years. So thank you for that.
Leader Lamberth.
Thank you, Madam Chairman. Commissioner, just good to see you today, and I appreciate the work you do. The job you have is one of the most difficult in state government, and appreciate you helping to form a proposed budget for us to review. We spend weeks and months doing what you spend the better part of 6 to 8 months putting together. So appreciate the partnership, appreciate your friendship, and just want to give you a public shout out on the hard work you put in. Thank you, sir.
Do I have further questions? Seeing none, well, Leader Lambert wrap this up very nicely with thanking you all for the work, particularly in this more challenging budget year. And we look forward to the AA. Commissioner, you had some closing remarks?
I have one closing remark, and that is when I come, it's a pleasure to come before you, especially with my team, because as you all ask these questions and I listen to them answering the questions, I'm very proud of our team and the work that they do. So thank you for the opportunity to be here and kind of show them off a little bit. Thank you, Madam Chair Lady.
Well, thanks to you and your team. Some of Ms. Dedman and Director Thurman, others that I've worked more closely with over time, but I know there's so many more people that we probably don't see in this room who just make a lot of contributions to getting this done. And if you want to get the AA to us sooner than March 26th, we'd be happy to receive it.
Thank you for that permission.
Thank you. Thank you, Commissioner. And we'll now ask our Commissioner Turner and his team if they would come forward. Good morning, Commissioner. Welcome.
Good morning.
I know you guys have been around for a while, so we appreciate your not only promptness, but early preparedness. You must have been a Boy Scout, so you're here
No,
well ahead of time.
not even on my best day was I a Boy Scout, unfortunately, but I know a lot of good folks who were. Thank you, Madam Chair. Appreciate it. Thank you, committee, for having us. To respect your time, I will move forward very quickly with introductions. Jordan Allen to my left, my Deputy Commissioner for Ops. Andy Kidd to my right, Deputy Commissioner for F&A, and Clayton Wells to his right, who is our Budget Director. And with that being said, I'll turn it over to Deputy Commissioner Kidd, and we'll get started on our presentation.
Thank you, Commissioner. Good morning, everyone. The first line item that we have is for our Tennessee Start Respite Homes, and this is our crisis stabilization teams that we have across the state. Currently, we have an 81% referral rate, meaning that when we receive a call for our crisis stabilization, 81% of those are able to stay in their homes or in the community setting that they're in. But with the other percentage that aren't able to stay there, we need somewhere for them to go. Typically, right now, that's going to be a hospital or interacting with law enforcement, and obviously those aren't the best possible places. We would much rather have these homes for crisis stabilization and de-escalation there. The next line item is for Katie Beckett case manager positions and case management contract. As you know, we received 1,300 additional slots this fiscal year when we partnered with F&A and TennCare to make that funding available. But with that, we did not include any case managers. And so this is for 9 positions, which would be about $800,000, and then the $2.9 million for contracted case management, which will work with our private providers on that. Jordan, you want to give a quick update on Katie Beckett?
Sure. Excuse me. Quickly, we are at total enrollment at this point at 3,016 young people and families enrolled in the program. That leaves us about 984 existing slots. And for reference, the rate of referral right now is about 100 per month. So about 984 slots left, and about 100 a month are coming in.
Great. Thanks, Jordan. Next line item is for seating and positioning clinic. This is $250,000 in operational expenses. This is cost of materials that have gone up year over year, foam pads, plywood, things like that. So this is just to make up the difference in the cost of materials increases. The next line item is for DSP wage increase. This is to take the hourly wage up to $15.37, and this is reflected in TennCare's budget. The next line item is a provider rate increase. This is also in TennCare's budget. This is to increase the rates that that are not affected by the DSP wage increase. So it's other clinical style rates as well. And Madam Chair, I'll take a moment there and make sure that you want me to continue forward. The next two are for the TCAD cost increases. Do you want me to continue on with those and then take questions for all of it?
Yes, let's do that.
Great, thank you. The next line item is for direct support professionals for the options program. And this is an increase in pay by 2.5% up to $25.95 an hour. And the last line item is for Alzheimer's and Dementia Care Respite Program. This is year 3 of a pilot program that the legislature put forward. And so this is the $1 million funding for that 3rd year. The next page is for our reductions, and this is for our waiver attrition and waiver utilization. That total amount is $36.3 million, and that's the reductions that we have. Commissioner?
I think, Madam Chair, we're happy to take questions from the committee if there's any, and appreciate Deputy Commissioner Kidd pushing us through that. Happy to really appreciate your partnership as a committee. I want you to know that we take this serious and how we work with the legislature. A lot of the good things that have been done inside TCAT, inside DIDD, has been because of you as well. So happy to take questions together.
All right, well, thank you. And we will also, I think, since the Commission on Aging is now part of your organization, we will go through those questions as well. So the first person on my list is Leader Cochran.
Thank you. And so y'all might have to take some notes. This is a long question. I'm gonna give you some background before we get into this. So it's regarding the Tennessee Early Intervention System. So in fiscal year 2021, the TEIS program was transferred from the Department of Education to DIDD. And so when we did that, we transferred 262 positions and $56 million in funding. Okay. At that time, the program served children from birth until their 2nd birthday. The 22-23 budget appropriated $21.8 million in recurring state funding, and that established 74 positions within TEIS to cover an additional, the expansion of services to a child's 4th birthday. Y'all with me? And an additional $12.3 million in recurring state funding to establish an additional 25 positions to reflect growth in the number of children using TEIS. The fiscal year 23-24 budget expanded the program further to provide services until a child's 5th birthday with no increase in funding or positions. All right, now here's the question. I know you've waited in great anticipation. According to your presentation at the governor's budget hearings in November, TEIS participation has grown from 6,800 in 2017 to 10,825 in 2023. So give us an update on this program and the recent expansion to cover a child until their 5th birthday. Has that gone smoothly? And then do you anticipate needing additional funding once this expansion has been in place for a full fiscal year?
Do you mind repeating that?
If we could have someone repeat that question.
Yes, sir.
It's online. Go to the recording.
No, happy that you asked that question. That has been a phenomenal program for us. Just to give the committee background for those that might not be as familiar with it, Tennessee actually became the first state in the country to expand early intervention all the way up to kindergarten eligibility for families, which has been wildly successful. A lot of this was feedback we received from parents who were a little bit hesitant to put their child into the public school system in their area because they might not have had the same ability to serve their child in some of the rural school districts, some of the school districts that might not have had all of those resources. And it has been a strong benefit for families. So part of this was driven by parent engagement with our department to say we really would like to figure out ways that we can continue to expand early intervention and make sure that they continue to meet the needs of our children. And that's exactly what we've done. So now Tennessee has become the model for the country in how we've done the expansion for early intervention. We've got record number of cases of referrals. We have record number of families that are enrolled and record number of children that are actually meeting milestones by grade 3. So I'm very excited and very happy about where we are with that program. I think unequivocally it was the right decision to do, and I think the data reflects that. So I'll turn it over to Deputy Commissioner Kidd, see if he has anything to add from the fiscal side, but from an investment side, we have seen a lot of the positive returns from the children that have been impacted by TEIS.
Yes, sir. To answer the fiscal question, we feel confident that we'll have enough funding for this fiscal year, but we work closely with Finance and Administration to looking at that and trending and projecting to making sure that we will have enough funding. I do anticipate we would see a funding request next fiscal year, but we'll have to see how this year plays out.
One more brief follow-up, Madam Chair. Okay, so also with that TEIS program, there are a number of vacant positions, about 61. 99 were provided. Just tell us about that. What's what's causing the vacancies? What are the hurdles to filling them? If you just give us an overview.
We've actually had a targeted effort to hire for those positions, and we're seeing a lot of progress over the last 4 to 5 months. So we anticipate all those vacancies going away by roughly July of this year. So we're being very aggressive. We're doing marketing to making sure that we can hire for those.
Awesome. Thank you all very much.
Chairman Faison.
Thank you, Madam Chair Lady. Good morning. Good to see y'all. The fiscal year 23-24 budget included $7.3 million in recurring state and TennCare funding to establish 36 position placements of the children of DCS custody with acute medical needs, utilizing vacant community homes to provide short-term placements with medical care. That was a good thing. Here, I have 3 questions kind of revolving that. Provide an update, if you will. Can you give us an update on this initiative? Are you placing children in the vacant community homes yet? If so, how many have been placed? Where have they been placed? Have you begun filling the positions to staff the community homes?
Yes, sir. Thank you, Representative Faison. That's one of the programs that we've been very closely partnering with DCS. One of the things that we've tried to be very intentional about, our goal and my personal goal is we have got to get every single child that has disabilities that are either in state custody or families that are in your community and my community to try to get them services. So we have at least 9 children, I think, now that are in the responsibility and purview of DIDD that we work very closely with DCS. One of the things that we're continuing to work closely with DCS on is also making sure that foster care and adoption are priorities. Commissioner Quinn has been very receptive to conversations that we've had to make sure that not only we're supporting their case managers and their department, but they're supporting us very effectively as well to make sure that we don't keep these children in these homes longer than they need to be, but we actually find a place for them to go with a mom and dad that want them, that love them, that care about them and want to support them. So I'll let Deputy Commissioner Kidd Allen kind of expand on that a little bit, but to answer your question, we have already begun that, and that process began last year.
The most important addition to that, I think, would be we have successfully identified and transitioned 100% of the children that were caught in institutional settings. So really, for the committee's purpose, what that means is kids that ended up at a hospital, they had nowhere to go once they were clinically stabilized. We opened these homes, utilized staff that had been trained candidly for 2 decades in supporting adults with really acute medical conditions, repurposed them to support these kids. And as it stands today, 100% of the kids identified that were caught in that limbo, if you will, have transitioned to our care, 2 of which are now in active transition to long-term settings. We hope foster settings that they can remain the rest of their child life until they turn 18.
Just a personal comment on that. I know someone who has been involved in that process, a child with severe handicaps, who is now in a loving long-term foster care situation with a sibling that was actually had lesser disabilities and has now been adopted. So this program, it really matters. It matters to the children. It matters to the people who love them, who may just not be in a position to care for them because of their needs. So I thank you. I think that's another thing that the state of Tennessee can be very proud of. Chairman Hicks of Washington.
Thank you, Madam Chair. Thank you for being here, Commissioner, and your team. The governor's proposed budget provides $1.5 million recurring state funding to establish 2 respite homes for Tennessee START program. START provides a crisis response for individuals who have co-occurring diagnosis of mental health and intellectual disabilities and disorders. So I have a handful of questions in that space. The proposed budget does not include any portions to staff these respite homes, and how will these respite homes be staffed?
Yeah, thank you for the question. So we're going to actually use our private provider network to manage these. So we'll be paying contracting dollars to our private provider network to manage these 2 homes. So they'll be responsible for the ones hiring staff.
So and where is the funding for that? Where will we find that in your budget?
That's the 1.5 million that's on that line item.
Okay, thank you. Chairman Hick.
Thank you, Madam Chair. Will there be any recurring costs for maintenance down the road, do you believe?
For the homes themselves, yes, and we already have that in our budget. We're actually using 2 of our existing ICF homes that no longer have people in them. We're using those 2 homes, so we'll keep the operations and maintenance cost in our budget. That will stay there. This 1.5 is just to pay the private provider to run those 2 homes.
Thank you, Madam Chair. So that being said, you already have infrastructure in place for these homes, correct?
Correct, yes, sir.
Okay. And where are they located?
So we're going to have one in Middle Tennessee and one in West Tennessee.
Chairman Hicks.
Thank you, Madam Chair. How long will an individual be allowed to stay in one of these homes, and how many beds do you believe will be available?
Yes, sir. So there will be a total of 8 beds available, 4 per location. Generally speaking, stays should be as quick as possible, intended to stabilize the individual and then reintroduce them or assimilate them back into the environment. Sometimes that requires Dr. Davis and his START team working with the environment from which they came to train staff or whoever the caretakers are. 30 days would be a maximum. This really is intended to be a short-term stabilization, a portion, a spot in the continuum of services, candidly, that doesn't exist today. But 30 days would be the max duration. Now, if people are not clinically stable, if they require medication adjustments, there can be complicated or complicating factors that might elongate that. But in the best situation, we're talking about a week. In a expected situation, we're talking about a number of weeks. But if it goes longer than 30 days, it means something is more difficult and probably requires a different level of clinical intervention.
Thank you, Madam Chair, and thank you for those.
Yes, sir.
answers.
And you mentioned there's one in Middle and West. What are their plans, if any, for East Tennessee?
There will be. We're working on that. We want to make sure that we've got access statewide for citizens that deserve and need those sorts of supports.
Do you have a location in mind, or are you still determining that?
That was one of the challenges with East. We don't have a vacant home quite yet to go forward with that. We didn't want to ask for dollars if we didn't have a home vacant to be able to utilize that right now. And we didn't want to have to purchase a home, obviously adding to the cost.
All right, and I think you mentioned in the budget hearings with the governor in November that you're working with the Department of Education to incorporate some kind of similar programs into the schools. Can you give us an update on how that's going and
Yes,
what
ma'am.
the plans are there?
Yes, ma'am. So I've met with roughly 100 different school districts across the state, and without question, the number one conversation point that we have had has been built around children with disabilities that have a dual diagnosis. So those that might find themselves in behavioral crisis in the classroom. Historically, what has happened is you call a principal, you call a guidance counselor, you call an SRO. What we want to do is work closer with the Department of Education to expand the ability for our START teams to also be on call to come serve the students that are in the classroom that might find themselves in a behavioral crisis in the classroom and be able to support the teachers. So we are rapidly moving forward with some plans around that. I just spoke again last week with another school district around those conversations. This is something I'm anticipating that obviously, as you're familiar with, is not going to go away with some of the challenges that we see in the school districts, but Commissioner Reynolds and her team have been good partners in wanting to do more for children that find themselves in this sort of challenging situation.
So is this program or have these conversations at this point? Do we have any START teams that have become involved already? And it's just a matter of getting those throughout all the districts in the state, or are we still just trying to figure out how it's going to work.
Yes, ma'am. It's a little bit of both. So each school district obviously has their own protocols around escalation, and we didn't think it was appropriate for our department to come in and tell them how they needed to escalate in their local school districts if they've been given guidance. So we're still trying to navigate some of those challenges there when it comes to escalation priorities. But that's kind of where we are right now. We're past where we were a year ago, but we're not near where we need to be to try to get to these children quicker. But we do have START teams that are available to start having those conversations, even with local school districts and professionals that are trained in those sorts of situations, behavioral specialists, mental health specialists. So we are doing that, but we have not started to formally implement a program that is conjunction or in partnership with the Department of Education, but I anticipate that being our next step.
All right, we will look forward to having that actually a process in place for that to happen.
Likewise.
We talked about the START respite homes, and then we have the Tennessee Strong Families respite homes that house DCS children. Are those completely separate? Is there an opportunity to have them co-located or?
Yes, ma'am. They're separate right now. We obviously want to be very sensitive to the needs of children compared to the needs of adults being in proximity there. Those programs both serve a really unique need. So they're separated right now, and it's not something that we would anticipate where we're just putting everyone in the same spot. We did that before, and that was called institutions, and that's not something we want to go back to, nor will we go back to under my watch. So we're being very sensitive to the needs of each of the individuals, children and adults included. Andy, you want to add anything to that? Thank you, Madam Chair.
Chairman Kiesling. Well, he stepped out. Chairman Moon, you're the person who actually stayed in their seat to ask their question.
Thank you for being with us this morning. I've got a question about inclusion parks. In the 23-24 budget, there was $2.5 million in non-reoccurring state funding to provide grants for inclusion parks statewide. The awards were capped at $500,000 each. Can you provide us an update on the program, and have the funds started going out yet?
Thank you for the question, and it's been a great program for our playground grants. And to answer your question, yes, all the funding has been allocated and is being provided to those different areas as they show the expenditures, because it's a reimbursement-based grant. So we were able to have 7 recipients for that. We had 6 that had almost $500,000 apiece, and then what we had left over, we gave to the last or the next best awarded. Just for background, we received 86 applications, which was very exciting for us to see that there's a need for inclusive playgrounds. Had we been able to fund all of that, it would have been around $30 million to fund all of those requested applications.
Chairman Moon.
Thank you, Madam Chair Lady, and you did a great job anticipating the additional questions on this area. Thank you so much.
Yes.
Thank you, Madam Chair.
Chairman Hicks of Hawkins.
Thank you, Chair Lady. Commissioners, good to see you and your staff here this morning. My first question is going to deal around ARPA funding. So the department received around $180.6 million ARPA funds to build 3 regional offices. And so as of December the 31st, I have that $2 million had been expended and $8 million obligated. Can you just provide an update to this initiative, and kind of, are you progressing as planned?
Yes, sir. The very high level answer is yes, we are, and very excited about that. There's going to be a number of services that we're going to be offered to each of the communities based on where the facilities are going to be and the locations are going to be. But I'll let Deputy Commissioner Kidd expand on that.
Yes, sir. Appreciate the question. Really exciting opportunity. We're actually finalizing the designs of all of those 3 facilities, and very excited to start the construction later this year. So that's why you'll start seeing a lot more expenditures towards the end of this calendar year and then into the next fiscal year.
And Director Kidd, just to go a little bit further, what are you seeing as far as costs? With materials and building materials, where they are all over the place, are you expecting to come in around budget? Of course, under budget would be nice, but I mean, that's probably not a reality. Can you speak on that as well?
Yep. If you ask me this question again next year, it might change. But as of right now, we plan to come in under budget in the sense that we have a contingency built into that 180 million. And so we should be able to finalize all three facilities for that.
Great. And then changing gears just a little bit, talking about the Harold W. Jordan Centers. Of course, I know last year you guys had a proposal that you brought forth to this committee talking about there be some repurposing there at the center. Can you just give an update on what is actually taking place there? And I know as a part of that, there was going to be some employees that were going to be moved around. And so I guess just as you talk about the center, how many employees were there, are there, and are going to continue to be there? And if those employees that left, where did they go?
So we are still operating the Harold Jordan Center, serving folks that have the very critical needs. Obviously, there's some complexities there to that. But we did, part of our reductions before have been some of the positions that were vacant from the Harold Jordan Center. We do still have some staff there that are working there. We have individuals that are being supported there. Jordan may be able to talk a little bit more about where some of those employees are, and Deputy Commissioner Kidd as well. But that's been a critical function of our department, and we're continuing to serve individuals there as we speak. So Andy, you want to add anything to that?
Yeah, absolutely. And to my knowledge, I don't believe any employees were fully let off. They were given opportunities to work in our other areas, in our community homes or in the offices. And so they were able to make that choice if that was where they wanted to go.
Okay. All right. Thank you very much. Thank you, Chair Lady.
And to go back to Chairman Hicks' first question, you mentioned the $180.6 million. You feel like you're on budget or under budget. Those dollars have to be, spent on time or refunded. If you actually are in the wonderful position of being under budget, do you have plans for those gap dollars?
Yes, ma'am. As we get closer, candidly, we will use some of those for nice to haves, right? We have the things that we have to have with the new facilities and, with the seating and positioning clinics, there are some things that we would like to have, but are a little bit more expensive. So as we get a little closer to seeing where we are, if we're going to expend all of those dollars, if there's any gap there, there's a lot of great technology that we can purchase utilizing that funds for the seating and positioning clinics.
Madam Chair, can I add one thing that I think that's important? What Deputy Commissioner Kidd just said is when we're talking about add-ons, it's talking about the ability to serve more people with unique technologies that are not happening right now as far as development for equipment and different things that they would need inside the shops to be able to serve more people. When we talk about investing additional dollars, if we have them, it would be 100% going towards creating more opportunities for service for Tennesseans.
So basically, we're talking about would be upgrades to just a sort of basic service. You'd be able, if there were dollars that were unallocated, you would be able to use those, and you would be able to spend that money in a timely manner to meet the deadlines.
Yes, ma'am. It would be additional equipment or things that we would want to do to be able to serve more children or different age groups that are inside our responsibility. Those monies would be dedicated to creating ways to do more of that.
All right. Thank you. Chairman Williams.
Thank you, Commissioner. Appreciate you in your service. I had a couple questions about the adult changing tables. I think we did $1 million non-recurring monies last year. I know Chairman Doggett is carrying a bill to kind of revise that process to try to improve it based upon our original discussion. Could you give me an update on where we are as far as the expenditure of those dollars? Maybe how many locations that you've been able to see, how your department is distributing those funds, or at least trying to help get those funds out, and who typically is probably the biggest user of
Yes,
that?
sir. And I'll let Andy speak a little bit in more detail, but the 30,000 foot view there, Chairman Williams, is this has been a remarkable investment from the state of Tennessee. I think most on this committee, if not all on this committee, know that Tennessee became the first state in the country that is being intentional in creating adult changing tables at their rest stops at different locations across the state. That has helped springboard a lot of these things. We have great partnership with the Council on Developmental Disabilities, who a parent, Chrissy Hood, was the one that said, hey, this is something that our state needs to look at, and started her own campaign that created this opportunity for all. In fact, Cordell Hall is the most recent facility in the state of Tennessee to have an adult changing table. And one of the things that folks have forgotten about is it's not just around children with disabilities. It's also for older adults who might need their dignity maintained because they need some supports in there as well. So now, because we've done that on the front end, The irony is we're now responsible for the aging community, and this is also going to help them as well. So I don't know if Deputy Commissioner Kidd wants to add anything to that, but it has been very well received across the state, and we have had multiple individuals and organizations reach out to us to talk about the grants, including a number of the professional sports teams.
Just to answer the question on how many, we've dispersed over 40 grants for that. We anticipate there's a lot more. One of the things that we work closely with Chairman Doggett on is the challenge around it was capped at 5,000, and these tables themselves usually cost some $3,000 and $4,000, and so that didn't leave any buffer for any construction that had to happen. So that was the bill that he brought forward this year, is to help us make sure that we can expend the right amount of funding and help more and more applicants get those.
So in the instance of an adult changing table, if I were all in, I guess in some cases maybe the toilet partitions were too small to be able to fit these, and so you had to upsize those or maybe remove another toilet or urinal in order to fit those in there. Those costs under the new plan, those costs would able to be able to be a part of that, or are we just raising the number so it can make it more affordable so that more people can do it? Because the whole reason for originally doing it was to eliminate the cost impediment of it, particularly in areas where we couldn't get those services.
Yes, sir. That's exactly right. And we'll have a committee reviewing those applications to making sure the reasonableness of the cost that they're requesting.
Okay. Thank you very much.
Let's go ahead and skip me.
Okay, I did have, when we were talking about the changing tables, and, I think that's, as you mentioned, it's a great initiative, and, again, going to provide a level of dignity for both, particularly adults, that has not been afforded to them before. Are there other initiatives out there that we need to be looking at that would, just further engage and make life easier for Tennesseans with those kind of disabilities?
Yes, ma'am. And I think that's part of the privilege we have being tasked with, is making sure that we help advocate for that. So we've got great advocacy groups around the state that share that information with us. I get reports from different councils. There's a number of different things that we want to keep doing. But one of the things I want you to be proud of as a committee is Tennessee is leading the country in these sorts of developments and the ability to serve more people while maintaining the highest level of independence possible. In fact, Deputy Commissioner Allen and I are about to board a flight to go to South Carolina because they have asked us to come over there to talk to them about how to reform their entire system. We've been to Kentucky. He just told me that Alaska has called. So I want this committee to be proud of that too. So there are a lot of things that we're looking at that when we bring them to you, it's because the urgency level is there, and that it's not something that we're just saying, hey, while we're here, we might bring this up. Respite is always going to be a consideration. Our workforce, maintaining their mental health, their well-being, their emotional well-being. DSPs have an incredibly hard job supporting people. Caregivers at home have an incredibly hard job to support people that require 24/7 support. So what we're going to continue to do is make sure that we advocate for all of the things that you just asked about, Madam Chair, to make sure that you know about them the same time we know about them, because we can't do it without the committee being a good partner, and we can't do it without people being transparent with us and sharing information with us about what they need. Respite, a number of other things, even food security. Service delivery in rural areas, service delivery in inner city areas, challenges that all of 95 counties have, that we just have to come together to talk about and figure out creative ways to be solution oriented instead of problem oriented, and making sure that we're doing that. And that's exactly what we've been doing inside DIDD for the last 5 years.
Well, thank you. And I know that you are a personal, strong commitment to that, as everyone in your department, and we do appreciate it. And you mentioned DSPs, and I would be remiss if I didn't thank the administration for putting that pay increase into the base budget this year. It's the first time we've not had to fight about that. So I'm grateful that it's there. Chairman Kiesling.
All right. Thank you, Madam Chair. Gentlemen, Part B of the Katie Beckett program provides $10,000 to families annually to help meet their child's needs. Now, it's my understanding you all reached your cap. What was it at in September of last year, to the tune of 2,700. So I have a part during the governor's budget hearing. You mentioned that TennCare had made available these 1,300 additional slots. So can you provide us with information on the process and how that increase in those slots was accomplished, please?
Yes, sir. So we, since that time, have utilized an additional 300 of those 1,300 that were allocated, have just south of 1,000 of those left. Something else that we've seen building over the course of 3 years of this program is just awareness and familiarity. The result of that has been a pretty dramatic increase in the number of families approaching us. We measure this obviously in terms of month and then quarter and year. But for the purposes of this discussion, we're now at 100, roughly 100 per month coming to us, whereas not very long ago, in fact, less than a year ago, that number was much lower in the high 30s or 40s. So the point I'm trying to make is we have 1,000 slots left. The program has been overwhelmingly successful in impacting families. Commissioner has talked often, I think even with this committee, about the Part B programming, keeping marriages together, and allowing people to be supported in the home with the family as opposed to displaced. We're grateful for the additional allocations that TennCare made available, and we anticipate that we'll get through those with certainty. Whereas at one time we didn't know if we would hit a critical mass. We're not close to that mass yet, sir.
Madam Chair. And that leads me to this, and I think in part you've answered that. So the next question is, do you think that these additional 1,300 will be sufficient to meet the demand for participation? Or do you anticipate this program will continue to have a need for growth? So
Yes, sir. I think right now it's both. There's always going to be families that are in need there, but I think right now these allocations that have come from TennCare and from this committee are going to meet the need that's out there right now.
Great.
Yes, sir.
All right. Follow up then, Madam Chair. The proposed budget includes a total of $3.8 million in reoccurring state and TennCare funding to establish 9 positions and contract case management services to support the increased number of program slots in the Beckett Part B program. Your department has a total of 250 vacancies, 45 of which have been vacant for over 12 months. Could you use 9 of these vacant positions for this initiative? And if not, why, please?
Yes, sir. That's a great question. So we have, of those over 200 vacant positions, 221 of those are direct care. So
Sorry, I'm sorry.
for direct care.
Direct care. Okay.
Yep. So nurses, our DSPs, things of that nature. So if we moved those vacant positions, and that's where most of our long-term vacant positions are, is those direct care. So if we moved 9 of those positions from there into Katie Beckett, in essence, we would be taking away our ability to serve more people in other areas.
Okay. Thank you. Thank you very much. Madam Chair, thank you.
Thank you. And Commissioner, we do have some other questions, but I wanted to just, before we get into those, maybe to look at the whole picture a little bit. I know that this year's budget, the administration budget, includes combining, giving you all the responsibility, you mentioned it earlier just briefly, for the Commission on Aging and Disability. So that will all be under the DIDD umbrella. That's 35 positions and a total of $64 million in funding. What's the plan for the transition? Where are we in the process? Are you already managing that, or is that something that is still to come?
Yes, ma'am. I think it's all the above. So Governor appointed me the interim executive director in December. And so we've already been working very closely with the current TCAT employees. It's been business as usual for us. We're making sure that we're incorporating TCAT into what we've been doing inside DIDD, while also learning some of the nuances that TCAT has to make sure that we're supporting them at the best level that we can. We also want to be respectful of the process, where we didn't get too far ahead of ourselves, as the legislature obviously has to approve that. And I'm glad to hear that everybody up here is going to do that for us very quickly, and that will be good news. But I'm excited about that. And so we've tried to make sure that we're moving forward, but being respectful of the committee and of the legislature themselves. And so once those things are all done and we're past that and it's been signed into law, we're absolutely going to be ready to go on July 1st, and we're going to be ready to go before then.
And we're hopeful that there are a lot of overlaps in those kinds of services. So it seems to be a reasonable um, accommodation and a
Yes,
reasonable
ma'am.
place for
And I think-
those services to
Yes, ma'am.
reside.
And I think that's been one of the most important things that we've learned from this is there's a number of the same challenges that individuals have experienced in the aging space. The folks in the disability community have experienced that as well. You're talking about access to services. You're talking about caregivers. You're talking about support professionals who serve those who might need a little bit of extra help. So there's some overlap there that I think we're going to be able to streamline effectively and efficiently and continue to serve Tennesseans at a high level.
All right. With that, I do have some questions I think that might be related to that aging population, beginning with Chairman Williams.
Thank you. Things I love to talk about: Alzheimer's care, respite care. Appreciate you guys very much. I did have a couple of questions about it, though. I noticed that this is a program we started two years ago. We had a little bit of trouble in the beginning because we were having difficulties getting providers really to get on board with it. We also had some issues as it relates to how to handle those reimbursements through TCADs. And I was just wondering if you could give me a little bit of an update on where we are now, how much of the money has been consumed, and see if you've gotten any early feedback as it relates to the result.
Yeah, thank you for the question. We have gotten a lot of positive feedback, especially as we've overcome some of the challenges around reimbursement and things of that nature. From a number standpoint, year one, which was the first fiscal year, we spent $335,000 out of that million. This fiscal year so far, as up to January, we've spent $461,000. So it looks like we're going to be able to spend almost all of that million this year. And with that, now that we have a third year, we'll be able to start really collecting better data on a full pilot program. The data from the first year isn't going to be as good. So having this year and then hopefully this upcoming fiscal year, being able to analyze the data, the benefits, and then being able to have a proposal for you all this upcoming fiscal year.
Chairman Williams, if I may add something to that too, that I think is important, and to your point, you're aware of this. I probably outside of obviously developing a cure and continuing to move science forward and how do we serve folks with Alzheimer's and with dementia, respite has been something that has been incredibly sought after in this community, both in disability and aging. So the fact that there's dollars that have been allocated, even in a grant program in something like this for a 3-year trial, has been immensely important to saving families. And so I never want us to miss that picture. Yes, there's a cost to it, but the cost not to do something is even greater. And when you talk about mental health, suicide, lack of care, it's this committee, I hope, takes some pride in that they've been parts of a solution here, respite program.
Thank you. I think one of the challenges too is because to a person who's providing care to their loved one and needing some assistance, I think it's their ability to get that assistance is directly related to who's willing to participate.
That's
Are
right.
there areas across the state where you say, they're getting it right, or these are kind of models of excellence as it relates to how to do that maybe we could direct other people if they're not in our community to be able to provide those services?
Well, and I think that's a good question. I think what we're doing is always trying to figure out what works that's scalable and making sure that what's not working, we don't repeat. And then come back and ask for more money and say we need it again because it didn't work. So we think if we invest this way, it'll work this time. So we're always looking at programs that are scalable around respite. And I think some of the things that we'll be able to bring online as well, including technology. We want folks that are aging and find themselves in this space to maintain as much independence as they can for as long as they can. Technology and things like that, I think, will help people, especially in the Alzheimer's and dementia space, and their caregivers. To your point, ultimately, there's better access to information. There's better access to relationship and community through technology sometimes. So we're always looking at partners that are getting it right and making sure that we figure out how to make that scalable all across the state. So to answer your question is, yes, sir, we're always looking for those that are exceptional to make sure that we continue to challenge ourselves.
Okay, finally, on the monies, you talked about it. We had a little bit of delay in getting started. We had, when the respite care reimbursement rate for the elderly is a better number than what we can do for respite care for Alzheimer's care, then obviously people are not going to retool their folks in order to do that. If the time runs out before the money does, is the intent of the department to continue to reimburse those until such time that ends? Or because we kind of got a late start, my thought was maybe we wouldn't consume all the money to get as much data, because the data is really what we're trying to get. I wonder if you could speak to that for me.
Short answer is yes, we would continue to pay that out. We anticipate having carry forward language to making sure that we have that full dollars. So in essence, we might end up spending 1.2, 1.3 million in that last fiscal year, trying to get all the possible data that we can, because it's not just about getting the funds spent, it's about the results from getting those funds spent.
Thank you. In closing, I would just say my daughter, of course, my family member, I had my grandmother at Alzheimer's, struggled with it for a very long time. But to the members of this committee and those 3 people that might be watching, my daughter came home this weekend and said, "Dad, you know that if we danced more, we would do a better job of pushing back the effects of Alzheimer's." So go home this weekend, folks, dance with your loved one or your kids, because it's going to provide some long-term benefit for you. Thank you.
Thank you, Dr. Williams, for your gerontological advice. We will certainly take that under advisement. Representative Barrett.
Thank you, Madam Chair. Good morning again, gentlemen. I'd like to follow up on Dr. Williams' line of questioning there. Could you talk to us a little bit about this program and some of the outcomes that have been reported, and then also touch on, I think the intent of the program was to serve, I think, 150 families. And are we going to reach that number? Where are we in that process?
Yes, sir. We'll reach that number. And the intent has been to get a better understanding of what we need to do. So that's obviously why it's a pilot project. But the outcomes that we've seen so far is the feedback we've gotten from caregivers, again, around the respite opportunities and the ability to actually serve their loved one. I'm a broken record representative when it comes to this, but as a parent of a child with a disability, I understand the wear and tear that it puts on caregivers, whether it's your older parents or whether it's your youngest child. And so the feedback that we've gotten is that these programs have not only been beneficial to the individual that has dementia or Alzheimer's, but it's actually saving marriages. It's actually saving people. And to me, that's where everything starts when we look at all of these programs and the conversations that we have. Is these are dollar amounts that we're investing that taxpayers from Tennessee contribute and work hard to give us. The least we can do is make sure that we're serving their neighbor as well, or someone that they care about. So to answer your question, absolutely, we've been meeting the mark on that, and we're getting better and better information about what we need to do in the future. And then I anticipate you'll see future requests built around respite grants, respite conversations, and things like that, not only in the aging community, but as the new department emerges as a whole.
Excellent.
Representative Barrett.
So following up on that, and the Alzheimer's pilot program, there was, I believe, $664,000-ish as a balance at the end of the last fiscal year in June. So how much of the previously allocated funding has been spent, and what's next for that program?
Yes, sir, that's a great question. So we anticipate spending about $900,000 this year of the million. So going into next fiscal year, we plan to continue that $600,000, carrying it forward into the next fiscal year. So that'll give us about 1.6 million. And we anticipate we'll be able to spend that amount so that we'll have a good picture of, after we've spent $3 million, what do we need going forward?
All right. Thank you both.
Yes, sir. Thank you.
Representative Parkinson, I believe you need to be recognized out of order.
Yes, ma'am. Thank you. I want to recognize 2 of our Bartlett aldermen, Kevin Quinn and Monique Williams. Monique Williams, history-making alderman, first African-American Bartlett alderman. Y'all stand up. Make them feel welcome, if you will.
We're very happy for you to join us here today. Leader Cochran.
Thank you, Chair Lady. This question is not as long. In case you didn't get to hear from me enough earlier, I've got a follow up. So TCAD was awarded $57 million in federal COVID relief funds. 29.4 of that, those expire in September of 2024. Of those funds, we've spent about 6.5 million. So have there been any barriers to spending the full amount?
Yeah, thank you for the question. The biggest barrier has been resources, and that's resources in the community being able to actually provide whatever program that was. So we have a variety of different programs, nutrition, respite, things of that nature, and services that we can provide. But the biggest challenge has been getting providers to go and actually perform those services. I think one of the things about the merger that is about to happen is that we have a provider network that has the same heart as those and taking care of the aging population. And so we anticipate working with our providers and the existing providers, and to making sure that we can expend those funds. We have been in close communication with ACL to see if they're going to give us an additional year to expend those funds. So we think we'll hear back in the next week or two whether or not we'll be able to continue to use those funds for an additional fiscal year.
And then just one follow-up. If that extension isn't granted, how much would you foresee returning unspent?
That's a great question. I don't have a great answer for you. I think we have earmarked an additional roughly 15 to 20 million that we could probably spend by September. So there's still remaining amount that we would need to return if we are not granted that extension.
Okay, thank you.
And I know this is an unfair question, but this can't have been the first time one of these kinds of requests has been made. So what do you view as the likelihood of that extension being granted? Because that's a lot of money that would go unspent if it's not.
Fairly likely that it will be extended. They
Could you,
typically would tell us no rather than maybe. So yeah.
All right. Could you let this committee know when you have the word on that, please?
Absolutely.
Yes, ma'am.
Representative Garrett.
Thank you, Madam Chair. Good morning. We're still in the morning. Appreciate you all being here. I've got just a couple of questions regarding direct support professionals and the options program. Could you tell me a little bit about the options program first, and then I'll dive into what my question is, please?
Sure. So the options program historically has served Tennesseans who are aging, and it's obviously a program that's been very important. And the reason it's important is what we want to do inside the options programs as well is make sure that adults do not have to find themselves necessarily being forced into other federal programs. Options program has created flexibility for us to do that. So I'm very interested to see what we're going to do as we move into the new department to make sure that we continue to remind folks that they do not have to go that direction, that Tennessee is providing an alternative for them to maintain their independence.
Great. Thank you for that.
Yes,
and then my questions as it relates to that program. In the governor's proposed budget, there was $353,000 in recurring state dollars to increase the pay for the DSPs, the direct support professionals in the options program. In fiscal year 2023, 1.25 recurring funding was provided to increase that pay for DSPs. And then of course this year there's that 300,000 to increase the pay. So my questions are related to that. How much was the pay of DSPs increased in the last 2 years? And have you seen any effect on staff retention or any turnover? And then my follow-up question to that will be, what rate will the cost increase bring to them, and is it sufficient? So if you could elaborate on
Yes,
those,
sir.
that'd be great.
So over the last couple of years, we've increased it a few dollars. We're now up to, make sure I get that right. Sorry, $25.95 per hour. So that was in the 23 range 2 to 3 years ago. So we've increased it about $3.50.
Those are my questions. Thank you, Madam Chairman. Thank you all.
Thank you, Representative Garrett. Representative Shaw.
Thank you, Madam Chair. If you would allow me, I have 2 or 3 questions I'd like to pose, if that's all right, Madam.
That is. Go ahead.
Thank you so much. Thank you all for being here. And I think Dr. Williams might be right. When we dance more, we can get along. But thank y'all for what you do, and we really do appreciate your work. I want to begin by saying in fiscal year 22-23 as well as 23-24, I think about $1 million was budgeted each year for non-reoccurring state funding for the grants for senior citizens. Of course, I know that these grants, they are issued on a competitive basis. Can you provide an update on the grant program? I'll start there.
Yes, sir. So we have successfully allocated grants to different senior center organizations across the state. So those dollars are incredibly important. I think one of the things that makes this really unique, Representative Shaw, is we've worked very closely with the local community officials on that. I just had a meeting last week with several different mayors from East Tennessee and about 8 different counties. One of the conversations we had was built around the importance of the grant program for their senior center organizations. One of the things that I'm anticipating, we're going to have the the opportunity to be able to do is try to expand that program and figure out how do we allocate more dollars to more organizations across the state that meet the needs of our senior citizens. I think one of the things that we want to look at and continue to look at is the challenges in the rural areas to have organizations and programs that are set up for that. But it's been successful, and we anticipate on my side to expand that program and make sure there's more dollars available for those centers.
Well, good, good. How many grants were awarded in the fiscal year of 22-23?
We can
About
125. Thank you. Perfect. Thank you. 125.
125.
Yes, sir. I had to go to the experts, Representative Shaw, really quickly there.
Was that pretty much across the state
Yes, sir.
equally, or was there more granted in one area than the other, basically just across the state?
It's not, if it was done in one area, it would have been unintentional. The intentionality behind this is make sure that all 95 counties have access to that. So my comfort level in saying is very high in saying that that would have been spread across the state.
So how much funding, that is, has gone out of the door to this state for fiscal year of 23-24?
In grants only?
In grants, yes.
$1 million.
Wonderful. I believe my last question, Madam, is grants have been awarded on a competitive basis under the last three budgets. So have there been any barriers or administering these grants in any shape, form, or fashion?
No, sir. Again, to your question, sir, only barriers would be, I wish we had unlimited supplies of money to help everybody. But knowing that we don't, we have to be very diligent with taxpayer dollars. And that because of that, we've had a really good success rate in making sure that we're getting it to people that we know that have needed it. It's been competitive. But you can anticipate us coming back and saying, hey, we've got some even bigger ideas to serve the aging community in Tennessee. And so I'm anticipating we're going to be back asking for some more.
Thank you.
Yes, sir.
Thank you, Madam Chair.
Thank you, Commissioner. And I think I've had one senior center in my community who received one of those grants. It made a huge difference. And I do think, like the museum grants that we did, having the State Museum oversee those, having you all or the Commission on Aging prioritize the grants helps us to make sure that those dollars are spent in the most effective and efficient way. And I know that there's some effort given to make sure, to Representative Shaw's point, that we are spreading the love across the state, that even though we might have East Tennessee, I'm sure, had more wonderful requests than some other parts of the state, but we didn't get all the money because we wanted to be kind and spread it out. But in the budget, the 22-23 budget, there was money for the Commission on Aging and Disabilities for registry of unlicensed facilities. And that was earmarked for options funding. And I understand that registry is now live on the Commission's website. So do we have a good handle now on how many unlicensed facilities are operating in Tennessee and how many have been reported since we put this registry online and live?
Yes, ma'am. I think we're learning more about that. I think one of the challenges for all of us, and some of the cold truth behind that is you would hope you'd never run into unlicensed facilities or registries because you have enough licensed facilities that are meeting the need. And so sometimes these indirectly are created because there's nothing in their areas, right? And so that's not that we then allow that to happen. So I think one of the things, if I can answer your question and pivot really quickly from that, is we want to make sure that we continue to recruit folks that want to help serve the aging community in Tennessee. I think Deputy Commissioner Kidd spoke to that we've got a pretty robust network right now that we're going to lean into even more so to say, hey, we need your help now more than ever. As more and more older adults are moving to Tennessee and calling Tennessee home, we're going to need to continue to figure out ways to make our network as robust and as expansive as possible. So yes, we have identified some of those facilities. The goal is obviously to never have any. But until we help on our side, I think we're going to continue to monitor that and make sure that we limit the impact or some of the negative challenges that come from that. But understanding that sometimes these are not just bad faith actors that are setting up facilities or supports. It's because we don't have them in certain areas that people are like, we need to do something. So even as something as simple as maybe streamlining our process, in getting facilities and providers online to actually be in our network is something that we want to look at to make sure that we kind of attack this from all angles.
I certainly would encourage that, and I think most of the people on this committee would as well, because as you said, sometimes, particularly in smaller rural areas, there just aren't option, and it may be a good option for someone to be taken care of in someone else's home. And I think having the tag unlicensed facility is, it has some negative connotations that might not necessarily be there, as you said. So continuing to make sure that we can bring these people under our provider umbrella and make sure that, there are minimal standards that are being met and that people are not being abused or, mistreated in any way, would certainly be beneficial to us all. Chairman Baum.
Thank you, Chair Lady Hazelwood. I've got just one or two questions, but I'll start with a little trivia. In 2010, Commissioner Turner and I and Representative Stevens were all elected to the Rutherford County Commission. Chairman Sparks is a former Rutherford County Commissioner as well. And so what that means is state government is a great way to get rid of old commissioners. My question has to do with reversions. Your department has a target reversion of about $100,000. And I guess my question is what the source of these reversions might be. Is it from a particular department or program or particular agency within your department?
It's a great question as well. So it depends on the year, but typically we're able to reach both of those savings with payroll savings. Sometimes we do have to dip into operations to seeing if there's any efficiencies that we can have. So we do that year over year when Clayton and his team are building the budget. We make sure that we're able to meet those reductions based on our budget that we build for that future fiscal year. And again, sometimes that does come from operational, so long as that doesn't affect direct services.
And maybe just one follow-up question. Is there a particular barrier to spending, I guess, these funds, so that they wouldn't revert?
We typically try our best to make sure that we expend all the funds, so long as that we're being responsible with those, and those are going towards direct services. That's always where we want to push all of our money, is being able to provide those direct services. And so when it comes back to our typical year over year attrition and utilization reductions, those are the amounts that are coming out of TennCare's budget. So we don't see a whole lot of state appropriations that we can reallocate. We don't end up reverting much of that back. It's typically mostly the TennCare, which is the federal and state match, and those are earmarked for specific services. So we can't move that money around to do something else with it. And if someone passes away, we're not providing that service to them anymore, that's going to be a reduction.
Okay, that makes sense. Thank you all for your good work.
I guess to follow up on that, there was a abnormal, aversion amount, 22-23 of $5.4 million from the Commission on Aging and Disability. Was that, was there something, unique that happened in that year that we weren't able to allocate those monies, or?
What fiscal year was that? I'm sorry, did you say?
22-23.
I believe that was additional COVID. That was a COVID issue that we ended up receiving additional ARPA funding. And so there was going to be, we weren't able to spend the state funding portion of that. So that was what was reverted.
Okay. And to your Chairman Baum's question earlier, when you mentioned that, you have people who are eliminated from the program who pass away, but do we have a waiting list at all, or do we have everyone covered who wants to be on that list?
Madam Chair, are you referencing in the aging space or in the disability space as a whole, any of them? Yeah, so that's where we work very closely with TennCare on ECF to make sure that if folks are waiting on services, that we're figuring out alternative ways to try to meet their needs while they're coming through. I think Deputy Commissioner Allen can probably speak in greater detail to that, but we keep an eye on that religiously to make sure that if there are waiting lists in any space that we're in, we try to figure out other programs the individuals might be eligible for immediately to try to at least get them some level of support. And like a good example, that's our MAPS program for young adults who might not be on the ECF waiver yet, but still need a little bit of help around technology. You want to add anything, Jordan, to that?
No, sir, the MAPS program, to Commissioner's point, is now, has demonstrated an ability to divert people from the long-term waiver programs that you're talking about. We have built up, there is a new waiting list being built up. Thankfully, we were able to clear that for the first time in this Tennessee's history a year ago. Already, there's been some buildup again, but I think the new programs that we're designing are helping young people realize that they don't need a lifetime of supports. What we always say is they come to us and ask for a good life, not a lifetime of supports, and we're being able to provide that more than we have in the past.
If I can add one thing to that too, Madam Chair, I think the important thing here too is, well, TennCare has been a phenomenal partner with us over the last 5 years in making sure that if there are gaps there, that they work just as effectively with us to try to meet those needs. But the other thing I'm proud of that we're doing that Jordan just talked about is if you don't need to be on some of these programs, we should not force you onto these programs. So we've tried to create some real flexibility in different streamlining areas for young people and adults, older adults, to be able to choose where they want to go that meets their need and not try to force everybody into the same program if they don't need those. We tried that before, years ago, after decades of different care. It was miserable. And so that's not a direction we're ever going to go back to again. So creating independence and opportunity to choose where the individuals want to go for their services is something that's been incredibly beneficial for these programs.
When TennCare presented to this committee, we talked about some of these wait lists on some of these programs, choices and others. And while technically there is no wait list, they did say that there were people who were not receiving services because there was a lack of providers. So the programs that you administer, is that applicable to you as well?
Yes, ma'am. That's part of the challenge, and that goes back to the conversation I just had 5 minutes ago around we always want to work to expand our provider networks, because as more and more people are going to require services, and if we find less and less provider agencies are available to serve, that creates real strain on the system that can't handle that much more strain. So yes, we're working very closely with TennCare on trying to figure out how do we address provider agency needs and understanding that it takes money to run a business, and work to properly fund those entities, but also making sure, again, that if we don't have the right amount of providers, that there's still programs available, that the individual maintains their independence as well. And that's something that we've been doing historically.
Representative Sparks.
Thank you, Commissioner. Commissioner, how's your family?
Good, Mike, or Representative Sparks. Sorry about that.
Sorry. Okay. It's often said y'all are doing God's work. I think the chairman has said it many times, and you definitely are. It's also often said that a picture's worth 1,000 words. I'm looking at a picture of our governor and your daughter, Kinsley.
That's right.
And Charlotte, Allison Dempsey Burnham's daughter as well. I appreciate our governor and the great work he does in your department. Going back to what Chairman Williams mentioned about dancing, I know that's kind of outside the box, but last week was music therapy week. A lot of music therapists up here. I've shared with this committee, I've got a sister in a nursing home, and she's under hospice care. And I heard her singing the whole song, Country Road, Take Me Home, Place I Belong, and she didn't know my name. How important is it for music, dementia, Parkinson, other disabilities like that to you? And what have you seen personally?
Yes, sir. It's incredibly important when you're talking about music and the arts. And I texted you, and I've been praying for you and your family, just so you know that, because that's a challenge. But arts and music and things like that can stir up incredible memories for people, same as pictures. So even in our department, historically, we have done a lot around art, around the arts themselves, as far as plays and folks with disabilities actually being able to participate. It's a form of communication for all of us. I think it relays emotions, feelings, thoughts, whether it's through music, whether it's through picture, whether it's through paintings, whether it's through drawings, whatever that might look like. It triggers something in our mind that takes us back to a different time. And you mentioned your sister singing that song. There's something there for her to remember that. And so it's incredibly important. And that's one of the things I think that we want to look at, making sure that we understand more about how we can impact that, whether it's grants, whether it's programs that we partner with our state universities, our local high schools in our communities, to work on making sure that individuals have the opportunity and the privilege to experience music and the arts as a whole, because that's something that's important.
One last comment. The Freedom Playground that our mayor, Mayor Esther Reed, and Brian Hercules, Representative Stevens now,
right?
That partnership with our Rotary Club. How important is that? I mean, you've been there personally with your family,
yes, sir,
and other families. How important is partnering with nonprofits, Rotary clubs.
It's incredibly important. In fact, that's something that we have accelerated inside our department, is making sure that we're working with private entities, nonprofits, Kiwanis clubs, Rotary clubs, any organization that's a nonprofit organization. We're working to try to figure out better how we can work with them. And specifically, one of the things that we've started to do over the last year is get really aggressive around faith-based initiatives, working with churches, houses of worship, to make sure that they know that there's an obligation to serve their community, specifically people that are vulnerable. So we've done that over the last year, and we've seen a lot of success and a lot of results of relationship building because of that investment.
Yes. Thank you, Commissioner.
Yes,
Thank you,
sir.
Chairman.
Madam Chair, if I may add real quick, that it's always good to see Representative Sparks. And when he's here, it's interesting because the motorcade he drives in Smyrna is no longer there. So it makes Sam Ridley much easier for me to get down. So I appreciate his service at the state.
We'll do our best to keep him out of your way.
Yes, ma'am. Thank you.
Chairman Hawk.
Thank you, Madam Chair. Commissioner Eugene, thank you
Yes,
as
sir.
always. I want to take our conversation back about 30, 45 minutes ago when we were talking about the new three regional offices, and I'm blessed to have one of those in my district.
Yes, sir.
As you are looking to add components of services now, remind me again the mission of these three regional offices. I know seating and positioning clinics is what we've talked about, but
Yes, sir.
there's also some amazing opportunities that could come before us, and I think the financial our gentleman mentioned that before, but let's talk again about the mission of these three regional offices.
Yes, sir.
And I'll take us back to the community homes that have been built for several years now, and how we have repurposed a few of those for serving children with needs. So let's talk about the purpose of those three regional offices, and I'll have a follow-up, Madam Chair.
Yes, sir. So just very quickly, Chairman Hawk, at a high level, it's for us to expand service availability for those regional areas. So not only seating and positioning clinic, but enabling technology, job placement, job development, clinical conversations that can happen there on that campus. So not only is it going to be a hub for our employees to actually be able to work from, but it's going to be an expansion of the opportunity for us to help Greenville and a lot of those folks in East Tennessee who might need those needs that historically we've not been able to meet those needs. This new facility is going to allow us to be able to expand our service delivery.
Chairman Hawk.
Thank you, Madam Chair. And again, we've gone on to further conversation, but I want to go back to Katie Beckett.
Yes, sir.
And we've got two different organizations. We've got TennCare, Katie Beckett Part A. We've got DIDD now, the new moniker that we've got for Katie Beckett Part B. For us as a committee and for the community, as the three people that Chairman Williams mentioned are watching, although I hope there's a few more than that, but the folks who are watching, tell us what's the right door? What's the correct door for families as they're seeking these services, either from your department or from TennCare? Thank
Yes,
you.
sir. So that's a great question that we have conversations about every day in our offices. We don't want there to be a wrong door approach inside our department. So respectfully, if they reach out to our office, we're going to get them to a Katie Beckett person to have a conversation about application and enrollment. So if you ask about what's a right door, they're welcome to reach out to our department. Our regional offices are available, and we will make sure that we route individuals through the appropriate channels to get them support, Chairman Hawk, as soon as possible. Yes, sir.
Leader Camper. Representative Shaw.
There she is, right.
Thank you, Madam Chair. I'll back up.
Leader Camper, you're
Thank you, Madam
recognized.
Chair. Well, Madam Chair, seems like every member has asked every question that I had, but I did want to make mention that I think it's important to have the respite care.
Yes, ma'am.
As a person who mother is, experiencing Alzheimer's, and my grandmother, and seeing the way my sister really needed respite care when she was taking care of both of them, and now me with my mom, it's very important to have. And I was hoping that, with the 3-year pilot we were doing, that you had some information you can share back with us. But I understand the point about we're still collecting data and
Yes, ma'am.
and getting data. So I look forward to hearing some of that. Also, Madam Chair, with respect to, I think you mentioned something about, I kept hearing alternative measures, alternative ways, alternative.
Mhm.
And I'm wondering, do you all have some kind of partnership relationship with churches in the communities?
Mhm.
Because a lot of churches, they're visiting the sick and shut in. They're out in the community seeing people. So do you all have any kind of programs that churches that, have their 501c3 and all of that,
Mhm.
whether you partner with them and how we get an information? If so, how we get the information to them
Yes, ma'am.
to be able to do that?
Yes, ma'am. We absolutely are doing that. In fact, we have our first major conference next month here in Brentwood, built around conversations with churches. Unfortunately, Leader Camper, less than 20% of the churches in the state of Tennessee have a program designed for families of individuals or loved ones with disabilities. So, biblically speaking, the Bible talks very clearly about to whom much is given, much is required. And I think this is a population, both on the aging side and the disability side, that we need to expand service reach from churches. So we are absolutely working on that. We've had some good initial conversations with churches that are doing respite ministries now. The challenge we run into, Leader, as you just alluded to with your own experience, the moment these programs go live, they have a waiting list because so many families need this help that churches now are having to try to send them somewhere else. I can tell you that my church doesn't. We have families that have driven as far as 50 miles for a 4-hour respite. Like, that's how desperate these families are. So yes, ma'am, we're working on that. We want to expand that. My anticipation is that's going to be a priority for us moving forward, not only with the disability space, but specifically with aging as well.
Leader Camper.
Thank you. And thank you for that answer. It's good to hear that you are forward thinking about that.
Yes, ma'am.
Look forward to maybe sending information to some churches to participate in the conference.
Yes, ma'am.
so
We
they
will get
can
that to
learn.
your office.
Okay, more. You can get it to the chairman.
Yes,
She'll
ma'am.
get it to us. Thank you so much. Secondly, you mentioned early on about vacancies.
Mhm.
And I think he said that there was about 254, 45, something around there, vacancies. And then some of them were chronic, like over 12 months. Can you talk a little bit more about why you think that is? Is it this competitive nature of the positions where they're going elsewhere, they can't compete, the amount that we're paying, or why are we seeing all of these vacancies?
Yes, Leader Camper, that's a great question. And the biggest is around our direct care folks, and those are nurses. Nurses is extremely hard to hire, and that goes department-wide, that's statewide for private sector as well as public sector. It's very difficult to hire nurses. So in essence, most of our long-term vacancies are nurses, but we obviously can't eliminate those positions because we use that funding for the payroll to end up paying contracted nursing to come in and help us there.
Leader Camper.
Yeah, thank you. I was thinking it was the nurses, with lack of nurses and a shortage, I should say, of nurses and all the competition around nurses and what COVID did in that space as well. So it's okay. Lastly, Madam Chair, I think one of the representatives, I can't remember, maybe it was Leader Cochran, talked about the amount of monies in your reversions. It really looks like a huge amount of money, like 60 almost $1 million worth of reversions. Can you talk to those reversions? I know the target was some 300,000 and you reverted about 60 million.
Yes, ma'am. So the 750,000 of state appropriations that we typically target to revert back typically comes from operational expenses and then other payroll savings. That, I think it's 36 million total that's going back this year is for waiver utilization and waiver attrition. That's specific to the 1915C waiver programs from
Okay.
10 Cares funding. And so those are allocated for direct services. And when people move out of the state or pass away, then we no longer have to provide those services or pay for those services. So that's the funding that gets reverted. There's no, we couldn't do anything else with that funding because it's allocated specific for those services.
Okay. Thank you, Madam Chair. Thank you so much for
Yes,
being
ma'am.
here, your commitment, the hard work that you're
Thank
doing. It means a lot to this committee. It means a lot to families in the state of Tennessee. And we've seen over the years how the wait lists have gone down. So I think you're doing some innovative things, and there's always more that we can do. And so we look forward to, trying to help you all move to that end.
Thank you.
So thank you so much.
Yes, ma'am.
Thank you, Madam Chair.
Thank you, Commissioner. We appreciate your time today. I don't have any further questions on my list. And again, I think Representative Sparks mentioned every organization in state government is critical, hopefully, otherwise we wouldn't have them. But what you all do really impacts people at the, the most basic level of just being able to live at home or live with dignity or just have needs met that a lot of us fortunately don't have to worry about. So from providing support through our DSPs and other service providers to the actual direct services that are provided by the state, I can't thank you and your team enough for the work that you do. And a big shout out to all those providers that are a part of this process. Without them, we could not meet the needs of these Tennesseans. So thanks to you, thanks to those teams. And we certainly are appreciative. And again, I want to thank the administration for the including that raise for our DSPs in the base budget. We are not nearly where we need to be. The DSPs, some of you might have noticed, their rate is going to be $15.25, I believe now. We have some other people providing services that were mentioned. Their rate's $25, and I'm not sure that there's $10 worth of difference per hour in the services that those people provide. So that continues to be a challenge that we're going to need to look at and address. But thank you for helping us to at least make progress on that.
Thank you, Madam Chair. Thank you to the committee as well.
Next up, we have our the Council on Developmental Disabilities. Ms. Piercy is the Executive Director. She and her team, I believe, have been waiting patiently. Good morning and welcome. Thank you for being here, and we'll just ask you to introduce yourselves and Director Piercy, your companion there, and then we'll ask you to get directly into your presentation.
Will do. Good morning. I'm Lauren Piercy, Executive Director of the Tennessee Council on Developmental Disabilities. To my left is our Deputy Director.
Lynette Porter.
All right. I will dive right in. Today, we have a short overview of our small, unique office, which I'll talk through before we dive into the budget, and I'll keep myself to 5 minutes here. I'll start with who we are, and I'm looking at the first page of your packet. The Tennessee Council on Developmental Disabilities exists to improve services and supports to make life better for people with developmental disabilities and their families. We've already talked a lot about that this morning. That statement is our broadest mission. It's the reason that our program exists in every state and territory across the country. And in Tennessee, we've been operating for over 50 years. We are focused on people living with the most significant lifelong disabilities. So that's about 160,000 Tennesseans. It's about 2.3% of the population. The ripple effects, of course, as we've already talked about this morning, are much broader when you think about the families, schools, and communities that support each person. In the overall system, our office plays a very unique role. We are one of, if not the smallest office in state government. And we are the most connected to the citizens experiencing disability through the members appointed to our council who guide our work. You can see our council membership visually on the photo on your first page of your materials. In this photo, alongside the governor-appointed members, are representatives from state agencies who administer key disability programs in our state government. So DIDD is on our council, TCAT is on our council, et cetera. When those two perspectives come together, the decision makers in government and the people affected by government, that is when we can start to understand both what needs to change and how to change it. And in a nutshell, that's why we exist, and that's what makes us special. So now I'm going to turn to page 2 of your packets. We have brief examples of how this looks in action. So starting at the top, I want to highlight our leadership programs. This year, we're celebrating 30 years of our flagship program called Partners in Policymaking. More than 600 graduates are now leaders across the state, helping each other in local communities, in your communities, with the knowledge that they gain. They are the people establishing support groups, creating inclusive sports teams, fundraising for accessible playgrounds, and so on. They make our state better for everyone. We also have a First in the Nation Leadership Academy for state government employees. We do this in partnership with the Department of Human Resources and are very proud of the difference it's making within state government. Creating these pipelines of leaders who care about disabilities and are connected to each other is one of the ways our tiny program makes big, lasting change. So moving on to the second bullet on your second page, I always want to highlight Tennessee Disability Pathfinder. It is the one-stop information and referral center we have funded for almost 20 years. And year after year, we continue to innovate and invest in improvements. So last year, we launched an app and a chatbot in addition to the regular website and the helpline that have existed for decades. And this coming year, we'll be able to grow the helpline staff who actually talk to people, adding more bilingual speakers and someone who is located in West Tennessee who can help in the rural areas with more outreach. Please tell your staff that when they get constituent questions that involve disability, there is a 1-800 number they can refer people to, and they don't have to find those answers themselves. It's a very complicated, ever-changing system. And that's why we're here, and that's why we continue to fund it. So the final bullet point on your second page is just highlighting collaborations with you, the General Assembly. And I want to take the time to say thank you. Last year, we were celebrating $1 million for adult-sized changing tables, which has already come up this morning. And as Chair Lady Hazelwood, I think already mentioned, or maybe it was Commissioner Turner, we joined Speaker Sexton last week on Disability Day on the Hill to do a ribbon cutting for the first adult-sized changing table here in this building. So it's on the ground floor. If you haven't visited it already, it is really life-changing for people who visit this building. It's also symbolic that you care about welcoming people to this building. So thank you so much. So now we can turn to why we're here today, which is our budget. And I'll say that the reason we can do everything I described above on a relatively small budget is because we leverage partnerships so effectively, including with you. We hope you'll agree. We think we're one of the best returns on investment in our state. And with that, you can turn to page 3, and I'll turn it over to our Deputy Director, Lynette Porter, to go over our budget.
Good morning. Yes, so for for state fiscal year 25, we are requesting permission to spend $1.7 million in federal revenue. It's $1,747,600, level funded from the previous year. We're also including the $580,000 in interdepartmental revenue, and this relates to Pathfinder that Lauren mentioned earlier. We don't fund Pathfinder alone. It is a partnership with 7 state agencies. I had to count them all this morning. So all of those agencies are also contributing to the Pathfinder collaboration. And then we also have the appropriations request of $507,800 for next year. Thank you.
Thank you, Lynette. Before we invite your questions, I will just explain what the next 2 pages are, and I won't go over them in detail for the sake of time. So the page after the budget shows a map of where our members live. These are the governor-appointed citizen members who experience disability. Rep Sparks, Allison Bynum was on our council until very recently. Representative Boyd, Clancy Hopper visits you every year. We have lots of your constituents on our council, but as you can see on the map, we take pains to make sure that we're reaching well into the regions because we know it's different to experience life in Jackson than Dyersburg. So we try to cover the map really thoroughly, and it takes a lot of time and intention. You can also see the photos around the map. We take time to make sure we have diversity of life experience, race, age, types of disability, so that we are really learning about what it's like to be a Tennessean with a disability from a lot of different perspectives in a lot of communities. The folks in the pictures who have a yellow highlight are people who live in your districts, and you probably got an email from ahead of this hearing. On the bottom of that page are the logos of the appointed state agencies who represent, have a representative on our council, and the community organizations. So that's our membership, a little bit deeper dive. I'm happy to answer any questions. And then the final page just outlines our goals, which was a request from the committee. And I'd be happy to go into detail on any of those, but I will stop there in interest of time. Thank you all.
Director Piercy.
Thank
and,
you.
We do have several questions. Let me ask one first about your employment roundtable. You have a group of, I guess, community and business leaders that come together to help people with disabilities find jobs. Can you give us an update on how that's going and maybe how many people have been placed into positions of employment?
Yes, I'm so glad you asked. The Employment Roundtable has existed for about 15 years now as the state started to think about employment first. Over the last 2 or 3 years, we have folded the Employment Roundtable into the Employment First Task Force, which you may be familiar with. An executive order was signed back in 2013. We just celebrated 10 years of Employment First, and the Department of Intellectual and Developmental Disabilities really leads the Employment First Task Force per that executive order. So instead of running 2 parallel groups, the Employment Roundtable is now a subgroup of the Employment First Task Force. And the reason I say that is because we don't provide any direct services or collect data ourselves on the placements. However, every year annually, because of the executive order, there is an expect employment report issued with all sorts of data for the state. It's presented to the governor, but it's really for everyone to know what progress we're making. So the data I'll highlight for you is, we said every state agency collects something a little bit different about who's placed where, depending on your disability, what service system you're part of. So what we track is the gap shrinking between the employment rate for people with disabilities and people without disabilities? There's about a 40 percentage point difference, and it is shrinking. We set a goal in Tennessee that it will shrink by 5% every 5 years, and it has been doing that. So that's what we track currently, and the Employment Roundtable, I'm so glad you are following it. It's now part of the task force.
Okay, maybe one follow-up question about that. Can you tell us anything about the types of jobs that people with disabilities are getting?
Yes, historically, there were 4 Fs: food, flowers, filth. I'm forgetting the 4th one, but you get the point. So one of the things we've been focused on as a state is really expanding that so that people can be anything that they want to be, and not just because of their label sort of funneled into certain types of jobs. So really, and the department and TennCare are leading on this through Employment and Community First Choices. People are working in every kind of job that you can imagine, that you or I would imagine if we were growing up thinking about a career.
Okay, thank you. We'll get to our questions. First up is Representative Lynn.
Thank you, Chairman Baum. Thank you for being here. And I just wanted to ask you, the Council on Developmental Disabilities developed the LEADS partnership with the Department of Human Resources in 2015. LEADS is a leadership program developed for state employees whose work has a direct impact on Tennesseans with disabilities and their families. The 4th class graduated in the spring of 2023. Can you provide us with an overview of this program? How does each development program, how long does each development program last? And how many participants are in each program? And what the feedback has been that you've received from program
Yes.
graduates?
I would love to talk about LEADS. LEADS is the first in the nation program for state employees that we launched, that I mentioned very briefly earlier. Most states don't have any way for the different state employees scattered throughout state government who do work with people with disabilities to really connect with each other or know anything about disability best practices. So we kick off our cohorts with Commissioner Turner talking about the history of disability in an institution that has closed. So Clover Bottom is the location. And it blows the minds of our state employees. And they all have a heart for disability. They're doing different things from everywhere from the Department of Corrections to DIDD, and they're working, within the department that Commissioner Turner leads. So them coming together, they tell us is life-changing, not only to learn about disability that they've never learned about before, but then to have those connections to carry forward when they have a question. So I will get you the exact numbers. It's about 20 to 25 state employees that we have in each cohort. We have played with different lengths. So pre-COVID, we were mostly in person. Now we're a hybrid, and we can condense the program and do some of the learning and meeting online. So we keep innovating, and we do have survey data that shows us exactly what the results are. But I will say it's overwhelmingly positive. And they also do a final project together where we can then have something that different groups of state employees have worked on and implement those ideas. So one of them was about Tennessee Disability Pathfinder and how to get the word out about that program throughout state government. So we get a lot out of it. They get a lot out of it. And I think it changes our state government for the better.
Representative Lynn?
Thank you. Pathfinder is absolutely wonderful. I'm really happy with that. How many students are you able to take at one time into a program?
Into leads or into?
Into the classes for leads.
I think it's about 25. Sometimes we have some attrition, so we graduate more like 20. But we usually choose about 25 state employees. Each agency can nominate or recommend at least one. Some agencies send 4 or 5. So,
can you share any success stories with us from the program so far?
Yes, one that's just jumping to my mind is at TennCare, for example, there are people who work in the Office of General Counsel or who work processing applications way in the back, and they will meet the people going through the program during leads because we have them as speakers, going through the TennCare programs like ECF Choices. And they'll say, we work so hard all day to process these applications, and sometimes there's complications, and we've spent hours. And now we've met someone who's benefited from either a transfer between programs or an appeal or something that they would not normally get to meet the person on the other side or hear the different ways that other state employees then come into that same person's life. So that jumps to my mind. And the collaborations between the state employees, just thinking, I remember someone from the Department of Transportation who is the ADA coordinator got to meet all of these other people who work with disabilities. And for her, she's probably the only person in her unit who really focuses on disability. So those are things that come to my mind. Lynette, would you add anything?
I was actually thinking not the previous cohort, but the cohort before, a lady who had gone through the program. I cannot remember the agency that she worked for, but she was a parent or a sibling herself of someone with a significant disability. And to me, I was there for that graduation, hearing seeing the reaction of her fellow state leaders, hearing her talk about the impact to her family that having a disability has. I thought that was really memorable.
Thank you for the question.
Okay, next up is Chairman Faison.
Thank you, Mr. Chairman. Thank you for being here. Love your energy. Everybody on this panel loves your energy. Thank you. Quick question for you. The council manages the Tennessee Disability Pathfinder website, which works to link Tennesseans with disability information and connect them with the disability programs that are available. Here's the question. Are you able to track the number of visitors which are using that site? If so, are you seeing an increase in the visitor, the users, and how do you advertise the availability or the resource to Tennesseans?
Yes, I'll try to take those one at a time so I don't miss any. Yes, we track the number. We have quarterly reports from the people who manage Pathfinder most closely who report to the leadership team of funders that are the 7 state agencies Lynette mentioned. So there are tens of thousands of people who visit the website. It does continue to grow. And the reason it has continued to grow is because we've continued to bring on other state agencies as funders. So we keep getting new sources of funding and being able to, for example, have a full-time social media person, have a full-time, we're adding outreach in West Tennessee that we haven't had before. So we do keep innovating, and now we have a growing, we call it a leadership advisory group from different state agencies who can think differently than we've thought of for the last 20 years. So thank you for the question.
Okay, Chairman Hicks.
Thank you very much again for being here this morning. My question kind of revolves around the scholarship fund that the council has for Tennesseans. And could you talk a little bit about where the source of those for that scholarships, where they actually come from? How do you determine the eligibility, and how much funding has been provided in scholarships each year?
Yes, sir. I'm going to turn that one over to Lynette Porter.
Yeah, thank you so much for that question. This is one of my favorite. It's small amount of money, but the impact I feel like is really large. It's all of our federal funding is what supports the scholarship fund. We don't have any of our state appropriation in it. It is about $20,000 a year, which I know does not sound like a lot, but individuals with disabilities and families that are citizens in the state are able to go to conferences or workshops about their family's disability that they would not be able to go. We can help. I mean, it sounds small, but we can help them with their mileage in their hotel room, right? So they're able to go to and learn about disability and meet other families that experience the same disability that they wouldn't be able to go to without the scholarship fund. So it is very small, but I think the impact is very large. And I don't want to misstate how many individuals typically utilize the fund within a year. I could guess, but I'd rather send it to you afterwards. If I had to guess, I would say probably 100, but I don't want to, but we can send that to you.
Okay, if you can just send it to the
Yeah.
chair lady's office, that'd be great.
Perfect.
And also, does these scholarships cover both in-state and out-of-state?
It does
reimbursement?
cover out of state. We're not able to do as much of that because airfare is higher, but it does. There are some families that we can support to send to national conferences.
All right, thank you very much. Thank you for what you do.
If I may add, one of the eye-opening things for me is how many people with rare diseases are able to go to the one conference in America that is about their rare disease. And so recently, I think it was last year, someone who was one of 500 people who has this genetic condition was able to go to Michigan and meet other people and learn about that because of our scholarship fund. And like Lynette said, sometimes the difference between being able to pay for a hotel room and not pay for a hotel room is the reason they can go. So thank you for that question.
Fantastic. Thank you again. Thank you, Ms. Chairman.
Okay, Director Piercy, I think we are at the end of our questions. We appreciate all the good work you do with a minimal budget,
Thank you.
and we appreciate your time here today. So
We
thank you very
appreciate
much.
Thank you.
And I would like to call up the last group for our last budget hearing. This is the Department of Human Resources and Commissioner Williams. Yes. Okay. Okay, Commissioner Williams, you may get started whenever you'd like. You might start with stating for the record who you brought on your team, and then I'm sure we'll have some questions after your comments.
Good morning, and thank you for having us here today. With me today, I have Deputy Commissioner General Counsel Leslie Farmer. Also, I have our HR Program Administrator, Cindy Hobbs, and our Legislative Liaison, Eric Mayo. So just wanted to start off by stating that our vision is for Tennessee state government to be the best place to work. This year, Tennessee state government has been recognized by Forbes as one of America's best employers, as well as the best in-state employer. And this is based on experience and recognition from our employees. To continue this trajectory, we must strengthen our partnership with agencies by providing people solutions. And these solutions will help us to attract, grow, and keep our talent. We have made significant progress. With your support, we modernized our total rewards philosophy by overhauling our salary structure to provide market competitive pay while enhancing certain benefits. As we progress through this journey, we have to continue on our pivot from being a reactive to a proactive approach to human capital management. Our ask is for $1.4 million to continue our work and deliver a return on investment that will position Tennessee state government as a lead employer. Our presentation will talk a little bit about the return on this investment. Related to fiscal year 25 budget requests, there are two critical components that we focus on, and that's operational and technology. So at this time, I'm going to turn it over to Cindy Hobbs to kind of walk through our budget ask.
Good morning. I'm Cindy Hobbs, HR Program Administrator with the Department of Human Resources. For FY25, we are asking for an additional $1.4 million in funding due to increased demand for HR services to support state agencies and to provide funding initiatives that will result in long-term cost and efficiency savings. The funding will support the department's CFG goals and our 4-year strategic plan. As Commissioner mentioned, we are asking for investments in two critical components. First, in operations, we ask for an investment in several areas to support our operational goal and enterprise. First, we are asking for a continuation of consulting services to be extended with an investment of $285,000. The consulting and resource provided through this subscription will continue to give DOHR the ability to deliver strategic assistance, such as, but not limited to, hiring top talent, employee engagement, and reducing turnover. Continuing to have this subscription will help DOHR provide a forward-looking perspective and best practice tips as we leverage the changing workforce. And with technology, our first technology request of $995,900 is for an employee experience feedback and action planning software, which provides real-time employee feedback. The data and survey collection software will enable DOHR to collect, analyze, and benchmark surveys for action planning and tracking. In addition, the software allows DOHR and agencies to develop data-informed action plans and monitor results that will improve onboarding, enhance employee engagement, and reduce turnover. We asked for an investment of $14,800 for a legal case management system to track investigations throughout their life cycle. A case management system will allow the division to track investigations, ensure a balanced caseload among investigators, and most importantly, ensure timelines and completing manners to comply with MOU agreements accurately and efficiently. The current case management tracking takes away from resources directed to completing workplace investigations timely. The funding of a new case management system would allow for real-time updates, including the capability to run and pull reports and quick access to case information, allowing quicker resolution of a matter or more timely status updates or responses to inquiries by agencies. Lastly, we will be working with the Department of Military to administer legislation regarding Guard recruitment and retention incentives. This is recurring interdepartmental expenditures for the Department of Human Resources for a National Guard recruiting incentives package. And at this time, I'll turn it back to Commissioner Williams.
In closing, I'm extremely proud of the department and our role as we reimagine the workforce of the future for state of Tennessee. I'm also excited that we're well on our way to achieving our vision of being the best place to work. Our fiscal year 25 budget will support us on this journey to be the best. Again, I want to thank you for the opportunity to share our department's budget request. And this concludes my prepared remarks, and I open it up for any questions you may have.
Okay, thank you, Commissioner Williams. And our first question comes from Chairman Williams.
Thank you, Commissioner. Want to appreciate you and your staff. I know I have a couple of questions about data and retention, as well as succession planning, because I think it's really important for us to even understand those. I know there are some in the audience that absolutely love data, and I know we've made a significant investment in data as it relates to retention of our employees. That $995 or $6,000 that you could you tell me a little bit about that program and what makes it different, and what data you'll be able to manage that you weren't able to manage before without this additional input?
Yes, Representative. This is a employee experience investment. It's regarding our employees understanding their level of engagement. We can use surveys with this particular tool to engage our employees, hear from them, also identify where we have room for opportunity to improve. It also provides an action planning module. It gives us real-time feedback. We can use this information, implement the action plans, and then we can conduct what we call pulse surveys to kind of see, are we moving the needle towards our ultimate goal related to that particular action. This also helps us with 360 feedback, and it helps us. And what I think is one of the most important things is assessing our onboarding and how well we do onboarding. So it's a lot of data collection. We can then go back, look at the data, be informed with the data about how we want to move forward, if something is working or do we need to make an adjustment, or if we're doing something well, let's continue to do that.
Mm-hmm. So with this 990 some odd thousand investment, is a portion of that recurring costs in order to maintain the data and software? If so, in out years, what is it going to cost us to be able to maintain this retention tool?
Yes, this is a ongoing yearly subscription. For this, we'll keep the data, have access to the data, and use it. And again, I didn't know if I said this earlier, but this is for the enterprise. This is where we can look at all employees and state employees and use this information to help assist agencies as they want to improve.
Right. One of the, as it relates to out years, though, is it going to be $900,000 every year?
Yes.
Okay. So just to understand, 20 years ago, our retention rate was just over 10%. Now it's 19%. How long do you think it will take your department to be able to retain employees like it used to do 20 years ago? And is this what you believe to be the solution to that?
I would say, I don't know if we'll get back to the way it used to be. We're just in a competitive market. We have 5 generations in the workplace. They all see things differently and what's important to them. I think it is one of many tools that we have to use. Just to name another one is just kind of the culture in Tennessee state government. Again, incorporating that is with the total rewards, our benefit package, everything that's encompassed in it. What this tool does is just give us a pulse on what is actually occurring with employees. We can survey them, get their direct feedback. We can implement those action plans and then follow up to see if we're continuing to move the needle. As you said, the attrition, we have to reduce turnover and keep our good state employees. And part of that is culture, but also providing a platform where they can develop, have a career, and here at this, Tennessee state government.
Yeah. Finally, Chairman, The final question about secession, we've got 4,200 employees. I think it's pretty amazing. I've worked for my employer for 25 years, which is unheard of in the private sector. You've got 4,200 employees or more that have worked in state government for more than 25 years. The average age is just over 45 of our employees. What are we doing as it relates to succession planning, as it relates to replacing these folks that are approaching retirement? That's quite a vast number of people.
Yeah, yeah, that's a great question. We're currently modernizing our succession planning so we can help the agencies to identify those employees with their potential and creating a framework for succession planning to assure what you just described, that we have people prepared to take on these roles. And a lot of that is through development, leadership development, understanding what these employees' wants and needs are in their career.
Thank you very much.
Okay, next up is Chairman Boyd.
Thank you, Mr. Chairman and Commissioners. Great to see you today. I had just a quick question. Up there, you've got the consulting service for about $286,000, and that's supposed to be for talent and performance management. And the question I have is that something that could be done within your department without using that? And what's the benefit of using an outside consulting firm for that?
Yes, this is a consulting firm, and what it is a national organization that provides data and information around best-in-class services for HR, human resources. There are many others that on the legal side that provide that. On the IT side, that you can see what the industry is doing, look for those best practices. We've leveraged them to look at opportunities within DOHR to improve along the employee experience, similar to what Representative Williams talked about. But also it just helps us in providing additional, a really strategic resource that's going to help us in providing assistance to agencies from our perspective and the HR realm, but also understanding what is best practice and what is actually occurring. Like I used the example with IT, having a national organization that can help provide you with what is current, what is relevant, that just really going to make a difference in how we continue to move forward.
Okay, next, Chairman Hicks.
Thank you, Mr. Chairman. Thank you, Commissioner, for being here and your team. These questions has to do with the recruitment positions. So in last year's budget, it included $508,000 in recurring funding and authority to establish 5 positions to support enterprise recruiting efforts. This year, the department requested an additional $1.6 million for 10 additional recruiting staff. However, this request was not funded in the proposed budget. So have the 5 positions been established that was in the budget filed for last year?
Yeah, so the 5 positions, we use them to supplement our recruiting team, and they were contractors that we use to really focus on helping us recruit. A lot of times we look at recruiting in 2 different buckets. One is strategic recruiting. The other was more on the technical transaction side of recruiting. The contractors really helped us on the technical transactional side, where we could spend more time on the strategic recruiting. When I say strategic recruiting is we have to go out and find sources of potential candidates, such as, I'll just say nurses. If there's a need for nurses across the state, we can begin to identify where are some sources that we can get these particular nurses or accountants, wherever, and then have that available to the agencies to support them with their needs.
Okay.
Chairman Hicks.
Thank you, Chairman. Just to follow up, what are the current needs regarding recruitment, and how will you manage this workload without the additional 10 positions that you requested from the governor? How will you go about that? Thank you.
Yeah, we just have to be more efficient in how we operate. I've asked our team to really focus on the strategic aspect because a lot of times the strategic will help us with the transactional piece and getting the right, identifying those candidates in this competitive market. So we'll have a continuing source of where we can find candidates. So again, we just have to operate more efficient without having that approved.
Okay, Representative Love.
Thank you, Mr. Chairman. Commissioner, thank you for your presentation. Want to ask about what you and your department may be seeing as a trend for persons who are state employees. Do you see more persons desiring to stay in state government, or do you see persons exiting state government for the private sector when it comes to comparison of benefits and all that comes along with it? Because I know that many years ago, because of the compensation and retirement packages for government jobs, it was a preferred job. You knew you'd have a pension, you knew you'd have retirement, you knew you had a certain time to work. But just wanted to ask you what you're seeing in your department. What are the trends that you're seeing?
Thank you. We had similar conversation this morning about the trends, just talking in general from a strategic perspective. What we are seeing is our turnover numbers have reduced. We've seen a really good reduction in our turnover, and there's multiple reasons for that. Part of it is thank you for last year's work around compensation, getting a new structure in place, getting our employees to market competitive pay. But a couple of years ago, we did also a study, a total reward study, where we realized that our benefits are above private sector. Even our hybrid retirement plan is better than a lot of private sector retirement plans. The additional state holiday, the paid parental leave, the additional benefits. So we are trending above market. We're trending above market in our benefits and total rewards. The other piece of it is we're anticipating this to continue, but part of what we have to do is really tell our story better about working in Tennessee state government. Having the competitive pay, above competitive benefits, the work that we do, serving 7 million citizens and visitors, it's a great story. A lot of people have a servant heart, but now you can get compensated, competitive, you have great benefits, you can do that work. Now, part of our job is to get that story out and let people know that they can come to Tennessee state government and have a great career, not a job, a career. Yes, sir. Thank you.
Thank you, Commissioner. Thank you, Mr. Chairman.
Okay, Representative McKenzie.
Thank you, Mr. Chair. And that line of questioning was right down the same pike that I wanted to pursue. But thank you for the work that you're doing. And as a recipient of another entity's great pension, yeah, I can definitely do a commercial. Stay with state government. Pensions are good things, really, really good things. But as we looked last year's budget, everyone was kind of saying we need to get our salaries up. We need to get our salaries up. And y'all did a great job of doing that. But as you talk about where we are now and the total reward package being a good one, I would love to keep it that way. If we've done a great job, hey, we're patting ourselves on the back. If we do that for 3 or 4 years, we're going to be right back in this same predicament. So my question, I guess it's kind of twofold. What are you doing from a compensation comparison standpoint going forward, or what are your plans going forward? And then a question/suggestion, I would ask that you do those on a regional basis, because there are differences within our state. So how do those look, from east to west and middle and all parts in between?
Okay, thank you for the question. What are we doing going forward? Our strategy is best practice is that you do a total rewards study about every 4 to 5 years. And we didn't keep up with that in the past. This is part of our plan going forward, that we will come back and look at our total rewards about every 4 or 5 years. In the interim, we have to be very intentional to adjust our salary ranges. And usually that recommendation is about 1 to 2% per year. And that just kind of keeps you in trajectory to stay competitive. So that's our approach around that piece. When you're talking about regionally, when we did our comp study, we focused on, we looked at nationally, we looked at the data nationally, and then we looked at metropolitan area, the Nashville piece of it. And we felt if we kept our compensation at that metropolitan Nashville level, it will benefit some of our rural employees because you're paid at that higher level. And so our plan is to continue because we're paying you for the job that you're doing and your performance. And I understand, from a regional perspective, some areas are, there's probably cost of living is a lot more, but our baseline is Metro Nashville, which is probably one of the higher ones. So I think that's just a benefit for our entire state using that. So thank you.
Okay, Representative Shaw.
Thank you, Mr. Chairman, and thank you, Commissioner, for being here. Appreciate all your work. I want to kind of stay in that lane. My experience has been that employers do several things to get the word out about their benefits and so forth. So what vehicles are, if you can understand this, do you plan to use to get that word out about the compensations that the state offers and to stay competitive? We've got a whole lot of things going on in West Tennessee right now, and we're grateful for them. But we also would like to see people stay in state government. So can you talk a little bit about the strategies that you're going to use for that?
Yes, thank you for the question. When we think about the strategy, first of all, we've been working on a one-pager that describes our benefit package, sort of part of our recruiting piece, so people can see here are benefits that's offered. When we post jobs, we show the salary range of what the job is, and that has changed. They'll see that it's kind of competitive in the market they are. One piece that we're really working on and spending a lot of time and sort of our budget ask around the $285,000 net subscription is around marketing and branding. We have to do a better job of marketing and branding Tennessee state government. So kind of to your point, and then we can also need some market research so we can identify those target audience to send that specific message to make them aware of Tennessee state government as a potential employer. Well, no, not a potential, but the employer of choice.
Thank you, Mr. Chairman. Thank you.
Okay, and Chairman Williams.
Just as a follow-up, just wanted to say this body has done a tremendous job over the last several years, making sure that we get market rate studies as it relates to different departments. Even our administrative staff here last year got a raise. TDOT, we did lots of things because we found out years ago we were losing engineers and people to the private sector job. We also did the same with safety, to the disdain of many of our local sheriff's departments. But in making these market rate adjustments and also spending additional dollars in order to put additional matching funds and 401ks gone a long way from where we were 20 years ago when those retention rates were much lower. And so state government is always been a great place for people to be employed. It's currently getting better. We've made great strides, I think, in the last 10 years. And so even prior to me, this body has recognized that those market rate adjustments and the studies associated with them are what's making us better understand what it means to be in the marketplace competing against the private sector. And so I'm really pleased with the work you guys are doing and keep it up. Thanks.
Thank you.
Okay, Commissioner Williams, we are at the end of our questions, and so we appreciate you being here today and your team for your work. And absent objection, we will go back in session. Is there any other business? If not, then we are adjourned.